Today, the Committee on Health, Land, Justice, and Culture is now called to order. Today is Monday, February 8, 2021. The time is 5:34 p.m. Notices for this public hearing were disseminated via email to all senators and all main media broadcasting outlets on Monday, February 1st, and on Friday, February 5th, 2021. Notice was also published in the Guam Daily Post on Monday, February 1st, and Friday, February 5th, 2021. This Zoom meeting is hosted by the Guam Legislature's MIS staff and my committee staff, and they will mute all Zoom participants until called upon by the chair. Members of the committee or the legislature wishing to speak may indicate their desire to the chair by raising their hand or through the in-app chat feature. Individuals testifying shall first be recognized by the chair before speaking and begin by stating their name for record-keeping purposes. When called to speak, please, of course, ensure that you're unmuted. And we will begin with questions from the chair and then from the panel of senators. I'd like to thank my colleagues for attending today's hearing, beginning with our Legislative Secretary, Senator Amanda Shelton, our Minority Leader, Senator James Moylan, Senator Terlaje, Senator Tony Ada, Senator Joanne Brown, Senator Frank Blas, Senator Chris Duenas. Thank you, senators, for being here today. I'd also like to thank the Department of Public Health and Social Services for attending this afternoon's oversight hearing. Prior to the start of this hearing, those testifying today were all sworn in by the Guam Legislature's Sergeant of Arms, Mr. Ed Fukaigwi. Thank you, Sergeant of Arms. Today's oversight hearing is to receive updates from the Department of Public Health and Social Services on their efforts during the public health emergency. As you know from last term, there were at least 4 other oversight hearings on public health to keep the public informed of the public health emergency. This is the first one for the new term under the 36th Guam Legislature. The intent of this hearing is to hear more from the department regarding their plans to contain the virus through vaccination efforts and to meet the goal of achieving a 70% vaccination rate by July, and to discuss the department's COVID response-related hiring and staff detailing. In particular, we've asked the Department of Public Health and Social Services to provide information on the following: the role of the Vaccine and Antiviral Prioritization Policy Committee in the DPHSS vaccination plan, any updates to the interim vaccination plan, hiring and staff detailing at testing and vaccination sites and quarantine and isolation facilities, employee conduct policy for these sites and facilities, patient care guidelines for these sites and facilities, and quarantine and isolation facility resident complaint procedures. Director San Agustin, could you please introduce your team that is with you here today?
Sure. First of all, Madam Speaker and Committee Chair, Therese, Legislative Secretary and Senator Shelton, Minority Leader Senator Moylan, and members of the 36th Guam Legislature and the Committee on Health, Land, Justice, and Culture. With me this afternoon in our Incident Command Room, our Public Health Incident Command Center, are Chino Mbakwan. Then I have Xenia Piscina, Tom Tidegui, Janela Carrera, Masatomo Tom Nadeau, and I have Nick Rupley. He's here to assist us with our presentation this afternoon on the technical side. And then I have on screen, would you like me to introduce them, Madam Speaker, or would they introduce themselves? I can go through the list. I see them on screen as well.
Please do.
Okay, I have this afternoon also joining us, I have Dr. Felix Cabrera, Annette Uggan, Patrick Lucis, Deputy Director Dwayne Hughes, Dr. Kenny Shiro, Marilyn Scruggs, Rosanna Rambago, and I think that wraps up our team this afternoon, Madam Speaker.
Thank you. So, thank you, Director. We'll begin by talking about the vaccination plan.
All right.
Give us an update on this vaccination plan. Now, I've sent to the senators the material that was provided to me regarding the Guam's vaccination plan that I believe was sent to the authorities, but in addition to that, we have a detailed vaccination schedule, I guess, that has also been sent to us from Dr. Kaneshiro. Thank you. And so thank you for all the material that you've sent in advance regarding this vaccination plan. But if you could just give us a brief update on where we are today, Director.
Yes, Madam Speaker, if I may, we have a brief PowerPoint presentation that will cover many of the areas that you have listed earlier regarding our vaccine efforts, hiring and detailing, the role of the VA PPC, our vaccination plan, isolation and quarantine facility, areas of operation. And if we would allow us to just go through that, we will be able to provide you the information that we hope will be to the satisfaction of the committee.
All right. Okay. Thank you.
Thank you, ma'am. Nick, can we start? This afternoon, my team and I would like to share with you our information with regards to our efforts in COVID-19, and it touches on many different points from our efforts on the vaccine front over to the operations at QFAC, isolation facility, our homebound vaccination efforts, as well as the pods at the University of Guam. So if I could have, and our hiring and detailing as well. So Nick, if you could start. Okay. And so these are the key areas, Madam Speaker, and members of the committee, that we'll be touching on this afternoon. Of course, we're always open to your comments and questions thereafter, or throughout the presentation, ma'am, just at your call, Madam Speaker. So we're going to have different employees touch on the different topics this afternoon, and so we've already reviewed this, and so they'll just continue the process as we move on. So just a few 75.
So thank you, Director San Agustin. So by October 2020, department had close to 330 employees contributing to the department's response to the pandemic. These were primarily public health employees, but we were assisted by nurses, social workers from GDOE, along with the assistance from the Guam National Guard, and participants from the Guam Department of Labor Displaced Workers, along with a handful of other employees from other Guam agencies. As the response grew, so did our need for assistance, and thus, in October, a month later, additional 55 employees internally from the department were detailed to help in the effort. So this led to approximately 200 employees fighting COVID by end of November. As of today, there are approximately 261 employees from public health that are responding to the pandemic. But we continue to receive support from other agencies, such as the Guard, GDOE, DOL, and other agencies, including the 30 GDO nurses. So close to 375 employees are currently employed in the response, involved in response. And we continue to receive assistance from other agencies as well, such as Guam Police, Guam Fire, and at our vaccination clinic, we will continue to receive assistance from volunteers from University of Guam, Judiciary of Guam, AmeriCorps, Guam Community College, and local island dentists at our pod at Otaduke. Thank you.
The 261.
Oh, yes. So thank you. So the 261 public health employees, 209 are from the Division of Public Health, and the remaining 52 are from the Division of Senior Citizens, the Director's Office, Division of Environmental Health, and the Division of Public Welfare.
Next slide. So with regards to the hiring, since our last meeting, Madam Speaker, members of the committee, we have onboarded additional 16 individuals, actually 17. There's ACDC investigators, 2 admin support staff, 1 IT support staff. That's under our epidemiology and lab capacity grant. And in our Nursing Resource Command, we onboarded 6 EMTs for a total of 17 additional staff. In terms of our employee conduct, and that was one of the points asked, because we are a line agency, even when we hire you as an LTA or TA, and you're with us, all line agencies fall under Chapter 3, the Code of Conduct, as prescribed by DOA. So any issues regarding our conduct, whether here at the department or on the pods, points of dispensing, whether it's a vaccination site, isolation, or quarantine facilities, we're all subject to Chapter 3. There are other individuals that are involved in our efforts. Our contracted providers, these are individuals on contract based on their contracts to provide, for example, health services or cleaning services. Any concerns on either the health or cleaning services is brought to the attention of the contracted provider. The procuring entity is Homeland Security, so if we are not able to resolve it at our level, we raise it up to Homeland Security, who then reaches out to their contracted provider. What's interesting is that in the, for example, quarantine facility, there's really a sense that it's a complete 100% public health and social services operation, when in fact the procuring of the facility, health services from 8 a.m. to 8 p.m., and cleaning services are actually procured through Homeland. Cleaning services is procured through Homeland also for our isolation facility. Another effort that's there on site, for example, at our quarantine facility is a Guam National Guard, and they have an officer in charge. And so they're activated through Title 32, which allows them to work on this effort. And so as we have, again, concerns with regard to their performance, or if there's any complaints or concerns raised by the residents of either quarantine or isolation facility where the guards may be at, we again go to the OIC, and if we're not successful, then we move up the ranks. And so that's really how we address any employee issues with regards to their performance or conduct on site, primarily public health and social services being a line agency. See? Patient?
Okay, this is Patrick Lucis. I'll be talking about the quarantine facility care services. So we do have from 8 a.m. to 8 p.m. We have health services of the Pacific, health services contracted staffs. They cover between those hours. They provide contracted services for basic medical attention. They also conduct wellness checks. And then from 8 p.m. to 8 a.m., we have the Department of Public Health and Social Services nursing staff. And they provide basic medical attention, and they conduct wellnesses. When there is a complaint, there is a number that the passengers can call, the GUNG, HSP, or public health. And anything beyond the basic calls, they can call 911.
In regards to the isolation facility and patient care services, so our government isolation facility, or ISOFAC, provides individual rooms in hotels created with the goal of mitigating the spread of COVID-19 in our community and preserving hospital system capacity. The isolation facility provides food, shelter, and basic medical attention when needed. The DPHSS staff provides monitoring for COVID-19 illness to determine if further medical evaluation is warranted. If so, assistance is provided to a higher level of care. The facility is staffed with a nursing lead or supervisor who schedules and assigns nurses accordingly, a licensed nurse per shift who is in charge for that particular shift, and CNAs to assist with daily operations like vital sign checks and passing of meals. There is a physician on call 24/7 that the nurse may avail to. Patients are received from either home, hospital, clinics, and/or quarantine facility. Upon admission, an intake assessment is done. Vital signs are monitored twice daily on a regular basis. In addition, a wellness call is made by the licensed staff to identify any comorbidities that may be exacerbated by COVID-related symptoms. Allergies are also identified by food or medications, and anyone at high risk for closer monitoring. This is called an intake assessment. The nursing staff are trained on symptom-based predictors to detect early problems. We do have patient care SOPs, and patients are notified upon admission to call the nurse's station if assistance is needed. Should a patient need emergency care, a mechanism is in place to transport the individual to any one of our 3 facilities, and that's GMH, GRMC, or Devo Hospital.
So going back to the issue of complaint in the QFAC, we have direct lines to HSP, public health, and the GUN, so that various questions and concerns are forwarded to the appropriate entity to address those issues. And if questions arise, we also make sure that the staff who works in the QFAC that is best suited to handle the situation is reached out to handle it. But if it's not resolved, we forward it, like the director said, to higher authority. But if travelers request or file a complaint through the courts, we also refer to the Office of the Attorney General to support us in taking care of the complaint.
Madam Speaker, our vaccination plan has several components to it. It was originally submitted in October 2020 to CDC following the format that was required for all jurisdictions. The most recent update was December 4th in regards to the VAPPC, which I'll touch on later. But for vaccine ordering process, like all jurisdictions across the nation, we are given a monthly allocation. Guam, like other US APIs, are unique in that we order on behalf of the whole jurisdiction. So we serve as a central depot and then we redistribute to our enrolled providers. Next slide, please. We did enroll providers starting back in September, October. So of the 52, we have 42 providers who have agreed and 10 have declined. And again, there are requirements both at the federal level and at the Department of Public Health level in order to receive these federally funded vaccines. Next slide, please. Here we have the list of 19 providers, again, public and private, who are helping us in this island-wide effort to vaccinate our residents. And so these have already received vaccines or will be receiving tomorrow. And so again, this will be a monthly allocation that we can provide to them. And again, based on their scheduling or if they provide walk-in services. Next slide. These list of providers are ready. However, they have not either ordered the vaccine or 7 of these providers listed are pediatric providers. So they have to wait until US recommendations drop the age limits to below 16 years of age. And then next slide, please. This last group of providers, we are working with to onboard them. And again, it's a quality assurance effort that we want to ensure meeting all federal and local requirements. And so as soon as we onboard every provider, then we work with them to immediately distribute vaccines to them so that they can provide more opportunities to our residents. Next slide, please. Touching on the Vaccine and Antiviral Prioritization Policy Committee, or Vaccine Advisory Committee for short. And again, this was reconvened. It was first stood up back in 2009 for the H1N1 pandemic. And again, this group was to help guide the Department of Public Health and Social Services to help us refine the priority groups based on local data, because again, every outbreak is different per jurisdiction. Next slide, please. Our committee members were provided the Advisory Committee on Immunization Practices Ethical Principles, and these are the 4 guiding principles that we use when we have our weekly discussion on whether to expand to other groups. Again, prioritizing based on most at risk, most due to work or for medical condition or age. And again, trying to be fair and equitable across our island community. Next slide, please. This highlights in blue are the additional committee members that we've added on since 2009's committee, and just so that we can have a more diverse group to represent both public and private. Again, we have key members like licensure boards, as well as the new physicians advisory group that we did not have back in 2009. And then we do have some additional public health staff that are represented on this committee. Next slide, please. Here is the current phased approach. This was updated back in December of 2020. And again, this is subject to change by CDC based on the current epidemiology of the COVID pandemic. And so as things stand, we are still focusing on phase 1. It has been broken down to phase 1A, 1B, 1C. And again, this is due to limited vaccine that is made available across the nation. And so that we have to do a step-by-step approach. And again, the Vaccine Advisory Committee guides us on how best to expand this opportunity to our residents. Next slide, please. This is just a real quick summary based on the meetings we have had to date. I would like to point out January 4th and February 1st. The red indicates the refinement based solely for Guam. National recommendation was actually 65 and older, but again, based on data, thanks to Dr. Cabrera and all the medical providers who provide information on our case fatality, our COVID cases, Dr. Cabrera was able to provide to the committee that 60% of our COVID-related deaths at that time were for individuals 60 years of age and older. Then on February 1st, in regards to expanding it to other high-risk groups, again, based on the data provided and gathered by Dr. Cabrera and the epi-surveillance team, they also highlighted that individuals 55 to 59 years of age who have comorbidities are also at higher risk of COVID morbidity or mortality. And I do believe, Madam Speaker, the meeting notes and recordings were provided you for further detail. So this was just a real quick summary, ma'am. Next slide, please. Back in October 2020, this is what we submitted to CDC based off of what we actually implemented back in H1N1 with an upgrade. We conducted mass vaccination clinics, be it for H1N1, measles outbreaks in the past. And so we wanted to expand from doing a walk-up or walk-in clinic, like at the University of Guam Fieldhouse, which we did back in 2009. We also wanted to try and doing a drive-through. Again, we cannot do this alone, public health and the government of Guam. So again, we really look at our clinical partners at the healthcare setting to provide basically what's called closed points of dispensing or pods to help us immunize their residents while we take care of the general public. And again, this is both public and private partnership. And then we would like to expand to procure community-based vaccinators, be it an individual or a group or organization, to help us go out into these critical workforce populations and basically go from maybe an agency or to an organization while we take care of the general public. Next slide, please. However, this has evolved over time. And again, what we really were talking about for drive-through and walk-up, we've implemented some and we've had to do target immunizations for closed pods, meaning healthcare workers first, the ones who are frontline and the EMS. And so we stood up these pods at Ukuru High School. We eventually expanded to Southern Region Community Health Center. And Public Health actually conducted the first 2 pods at the University of Guam. And then our partners in the GUNG have now taken over that operation at the University of Guam. And so they have been, again, an integral partner in helping us with our vaccination services. We are now, with that partnership, we are now having our public health nurses and as well as the support through GDOE nurses to go out and target high-risk populations. We've done assisted living, like at Guma Tranquilidad. We will be doing Gumamami. We have the village level where we're going out to the Manumku who are homebound. We have conducted one senior center outreach down in Mauricio, and we plan to do more over the next few weeks. And we've also done some group homes, be it for persons with disabilities or again, Manumku. Next slide, please. In regards to our clinic setting, this continues to grow month to month. Again, we only started out with the hospitals and HSP clinic for homebound, but again, over the course of the past month and a half, we've added on additional private providers. We've also have our one pharmacy. Guam Behavioral Health has also provided vaccinations for their staff and their clients. And then 2 additional clinics in February, and I get to add one more on just today, ma'am. Next slide, please. And so we are still working on trying to obtain community-based vaccinator procurement services. So we hope to have that done over the next couple of weeks or months, ma'am. Next slide, please. So everyone's talking, I'm sorry, yes, ma'am.
Pause there. When you say procuring community-based vaccinators, do you mean they are going to be paid?
Yes, ma'am. In the past, for routine immunization, we have hired either individuals or like home health agencies to help vaccinate, especially because when we were experiencing a severe nursing shortage in public health. And so we wanted to augment our nursing services by having more opportunities for vaccination. So while our public health and GDOE teams were focusing on like the homebound or at the village level, we were hoping to be able to hire these individuals that maybe at the same time they can go out and take care of other essential workers that fall under phase 1B for example, like utilities, or you yourself, ma'am, and the legislature. We haven't, as we continue to expand through the Vaccine Advisory Committee, there will be more target groups that we need to vaccinate, ma'am.
Thank you.
Next slide, please. And so again, one of the goals for our national COVID-19 vaccination program is to reach this herd immunity. There's been a lot of changes over the past few months. We're hearing 70%, 80%. And so again, this is just trying to get enough people protected, either because they've been vaccinated or they've had the disease and recovered, to help prevent the spread of the virus in our community. And again, 70, 80% that are fully immunized, meaning 2 doses right now for Pfizer or Moderna, and down the road if any other vaccine is added on. And so this is something that, again, is an island-wide effort. Public health cannot do this alone. And so we appreciate all the key partners, as Mr. Nadeau had mentioned earlier, that have been integral for our vaccination implementation. Next slide, please. Moving forward, again, we will be focusing on these target populations. Again, we continue to work with our village mayors. We will work with the Homeless Coalition that we do have planned this coming week. We will be immunizing at the homeless shelter. And again, we have our other key partners like Catholic Social Service, and focusing on this community-based village level, going out to the community. So while the UOG pod is still operating, that people who have the transportation can go there, or they can avail of services at their private clinic. We will go out now to the community to reach as many people as possible, especially those who are most vulnerable, because underserved, lower socioeconomic, they have special healthcare needs. And continue to expand to our enrolled providers based on that list I mentioned earlier, ma'am. Our next group definitely is like the dialysis centers. Once we bring them on board, that will provide opportunity to the dialysis patients to do it at the center versus having to go and look at another place to receive the vaccination. Next slide, please. And this here is just a quick update on our vaccination statistics and what we have received to date. Last night was the most recent shipment that we received of Pfizer, an additional 7,800 doses. And we have been very fortunate that all our shipments have been received in good condition. So to date, we have 51,300 doses for both Pfizer and Moderna combined. Next slide, please.
You can just pause there. Sorry. I appreciate you're being very efficient, but yeah, it's a little quick. Just pause for just a second. Maybe just talk us through this. So these are total distributed.
Yes, ma'am.
Okay.
So, yes, ma'am. Every jurisdiction receives a monthly allocation, and it's kind of been up and down since December. But to date, we have received this much, and we have placed our full order every month. It does take about 3 to 5 business days to come on island, and through from the mainland. And so 2 different shipments because of 2 different companies. And so yes, as soon as we are notified that we are able to place an order for the next month, we immediately place that order because again, our goal is to really push out the vaccinations as quickly as possible to our residents.
And so if I may, Madam Speaker, so in December, we received 19,300 total doses. And then in January, we received our allotment of 15,000 total doses. And just as Annette said earlier, this past weekend, we received our most recent doses, but for February, we were allotted 17,000 total doses. So 19,300, 15,000, and 17,000. And that's our total combined for both Moderna and Pfizer at 51,300.
Thank you.
Thank you, Director, for the clarification. Next slide, please. And this here is just, again, the most updated information that will be pushed out to the JIC, if not already, that we've been doing this for 46 days. Our average is 769 individuals being vaccinated on a daily basis, both public and private services combined. And again, trying to really push to get that goal of 70% by July. And so again, we continue to slowly expand as we get more vaccines available and received on island. Next slide, please. and this is just, again, another summary of where we're at to try and get that set at that 70% goal based on our pending population and how many more individuals we need to vaccinate over the next 5 months, March to July, and making sure that they receive the full 2 doses properly spaced, be it 21 days for Pfizer or 28 days for Moderna. Sorry,
Please walk us through this again.
Yes, so based on estimate, if we're saying herd immunity, again, if we're saying at 70%, and again, for every disease, herd immunity varies. And so for coronavirus, they're saying it can be between 70 to 85, 90%. So if we're looking at the lower end of that at 70%, based on the population of Guam, we would need to ensure 117,825 individuals receive both doses of the vaccine that they started with. And so based on that daily track of where we are hitting just a little bit over 760 people per day in the next 5 months, March to July, to reach that goal of 70%, then we need to ensure that we can immunize 18,435 people per month. And then again, because it's a 21-day or 28-day spacing, the following, either within the same month for Pfizer or that the beginning of the next month, you'll be getting Moderna, then we need to make sure that you receive both doses to complete that and to be considered properly protected against COVID-19, ma'am. If it's at 80%, then we're going to have to work a little bit harder, increase the number of people we immunize on a monthly basis to reach that goal by July, ma'am. Next slide, please. Or any other questions? I'm sorry, ma'am.
No, thank you.
Next slide, please. And I believe Dr. Kaneshiro is going to expand more on the Homebound program that she is help leading with our nurses, ma'am.
Okay, so far, since we started, we've actually vaccinated 263 homebound clients and their caregivers. So we've we started last couple weeks ago, and so we're also continuing for this week as well. But this is what we've done so far: 263 individuals. Next slide. And so for this week, this is our schedule for UOG. This is from starting tomorrow to Saturday. This is UOG, and this is done by the National Guard. Okay, next slide. And this is for the Homebound. So we started today until Friday. So we're going to go to these various villages, and so we're pretty much done by Friday. And so for next week, we're going to start the senior centers.
Dr. K, can you just read those out, please, Dr. Kaneshiro?
Sure. So today we went to Agate and Sinohanya. Tomorrow we're going to go to Dedado. And then Wednesday we continue Dedado, including the Gura 82 housing. Thursday we're going to do the homeless at the Global Dorm and Guma San Jose. And then Friday we're going to do Jigo. And so next week we're planning to go actually to the senior centers next week. So we're still finalizing that.
Dr. Katie, did you mention that you did complete one senior citizen center? I'm sorry, I must have missed that.
I'm sorry. So last week we actually went to the Mariso Senior Center, and we saw 79 walk-ins last week. So we are going to go to the villages to make it more convenient for the our seniors to come.
Okay, maybe if I could just interrupt you right now. So on the schedule you sent me, there were none scheduled for the week of the 14th, the week of the 21st, for those 2 weeks. But you're saying now that you are going to be going to the senior centers next
Correct.
week.
And so today, I talked to some of the mayors. So for Tuesday, we're actually going to the Manilao Senior Center. And on Friday, we're going to go to Agate Senior Center next week. So we just finalized that this morning.
Okay, thank you.
I think this is the last slide.
Next slide, please. Dr. Cabrera.
Yes, sorry. Thank you, Madam Speaker. So this here is just going to be a general big picture overview of where we are right now. So this slide here This is actually data as of the end of last week, and I do have some a little bit more up-to-date data if you want me to clarify anything else further. But this is a graph of our CAR score, basically since the pandemic had hit its big wave in August. And as you can see, as our CAR score had jumped up on multiple peaks here, but for the most part has been, we've done very, very well since Thanksgiving actually, and have maintained that course for the most part, where our initial goal was to stay below 5, but our ultimate goal was to stay below 2.5, and we sustained that throughout this, through these past 2-3 months now. Next slide, please. This here is a representation of the daily new cases. And again, this is a big part of what makes up the CAR score. And as you can see, the similar trends in the graphs. And it's a 7.1 here, but right now we're at 6.4 daily new cases of COVID, and that's on a 7-day rolling average. Next slide. Now this is test positivity rate, and again, a big part of what the CAR score makes up. And so you can see similar waves in this, and then at this point it was 1.6% was our test positivity rate. As of today, we're at 1.9%, but still our ultimate goal was to stay below 3%. Obviously 0% would be ideal, but this is where we know that we're in good shape, so we continue to be so. Next slide. And then this is the last main variable that makes up the CAR score, and this is our retransmission value. And so this basically states that anything that's below below 1.0 means that the pandemic is essentially tamed or under control. And but anything above 1.0, it will lead to an exponential rise in numbers. And so we have been doing mostly well. These are a few bumps here, and these are relatively speaking. We do have a little bit higher number today at 1.1. And I will note that that's because a significant number of our positives are coming from the quarantine facility, as opposed to in the past where they made a smaller percentage of them. Next slide. And again, this is a little bit outdated here from the fourth, but now we have 130 total deaths, and our CAR score now is at 0.7. And in terms of our hospitalized patients today, we have 9 patients in the hospital. 7 of them are at GMH, and 2 of them in the ICU with and both on ventilators. And then at GRMC, there are 2 patients there, 1 in the ICU who's on a ventilator as well. So a total of 9. But for the most part, as you can see, we've done significantly well. Aside from our peak of 102 admitted COVID patients back in early November. Next slide. And so this is just a similar score, graph here, but it just shows the four-day COVID death summary and how it correlates with our hospitalization and our CAR score, and that's that gray shading in the background. And so we've gotten to a point where we only have like 1 or 2 deaths every 14 days or so here on average over the past month or so. Next slide. So this here was basically a polynomial trajectory looking at the amount of vaccines that we've been giving, and then what trend we're on here. So in discussions about the Operation Liberate Guam, or in other words, to try and achieve herd immunity before Liberation Day on July 21st, there were there's moving benchmarks, but for the most part, they're mostly the same. For example, for January, we wanted to get close to 30,000 vaccinations, and we accomplished that pretty closely by the end of the month. But what you see here is that we've also, the rate of our vaccinations have been increasing as we been able to get more and more partners to assist with the vaccination efforts. And you can see, and as the director had stated earlier also, and Annette as well, that right now our total allotment for February is at 51,300. And based on the rate that we're going, we're essentially, we could have the potential to use up that entire allotment by mid-month. And so basically what this is also really saying is that our real rate limiting step is not what we're doing here in Guam. It's what the federal government is providing to us in order to vaccinate our people here. So they need to be giving us essentially twice as many of the vaccines that at minimum that they're already providing to us. And so that's the one way that we'll be able to actually meet our goals. And so, but the next slide will help clear that up, I believe. The next slide, please. sorry, this is I'll get back a little bit to the vaccination, but I wanted to show also that with our incredible efforts here on Guam, as you can see, the penetration rate we have here in terms of the age groups. So those are 75 years and older. We have an 86% penetration rate, and I believe the most recent one is we're now at 87% penetration rate. In other words, getting the first dose of the vaccine into 87% of the persons who are 75 years or older on Guam. And then the second dose, we're already at 29%. So, close to 1/3 of our Manam who 75 years and older are vaccinated, which is a tremendous accomplishment. And then, so we're seeing numbers rise as well with the age group 60 to 74, for example. Some of the data will be coming in more, where we get the more up-to-date demographics, but this is all very, very encouraging overall. And so these are just different estimates here. So I don't mean this to conflict with any of the numbers that were given earlier, because we're just trying to see in simpler numbers. We're saying, well, right now if you count those, the vaccines are only have emergency use authorization for those that are 16 years and older. So we don't know when younger is going to be included, and the trials are ongoing. But let's say that that's all we could vaccinate, by July. Then we would have to consider what would be herd immunity for that population. So 125,000. So at 80% of those who are 16 years and older, that's almost a flat 100,000 persons. And so right away, we're already 25% toward that goal. And it's early February. Next slide. So sorry that this is poor quality and not able to see this closely, but basically the main thing to see here is that this is data that's it's a little bit outdated, but it's still pretty current. Thank you for zooming in. And so what you can see here is that when you look at shots given per capita, we are number 2 in the country, and American Samoa is number 1, Northern Marianas is number 3. And then you can see the other states that are well known to be doing well, like West Virginia, Alaska, they come in closer. So this is first dose or second dose, it doesn't matter. We're just saying shots given per capita. And then also the daily rate of shots given per capita. We are actually the second highest, also at 0.71%, meaning we're giving shots into 0.71% of our population every day. And then if you if we were to scroll down to like the lower part of this, so can we go and then to the right of the screen as well? Right. Just to some comparisons. To somebody that's lower down, like say California, it's 8.8% of the population has gotten a shot. And then again, we're at 19.2. And then just a little bit more to the right, please. And then in California, they're only going to 0.39% of the population is getting vaccinated per day, getting a shot in arm. And so that's California, and they're ranked 44. So this is data that's provided by Bloomberg. They're actually very good because they provide pretty up-to-date numbers. And if you were to go on their website right now, they actually are showing that we are still number 2 in first dose givens, and then we're number 3 right now in second dose given overall. And so relatively speaking, big picture is that I think we have a lot to be very proud of here on Guam. And this is the people's willingness to also get vaccinated. And then again, our rate limiting steps are going to be the federal government providing us the vaccines, and we are trying to seek every avenue to make those requests, to increase those requests. And then also we have to prepare for the potential downturn in interest in getting the vaccine as well that may happen in the later months, especially as we move down into lower age groups. So those are things that we're already looking ahead to and trying to think of ways to be prepared for that. I believe this was the last slide for me. Next slide, please.
Okay, just close it.
Oh yeah, this is the same metrics, but then was just arranged by the rate of shots given, so we won't have to worry about that. And you can see we're still number 2 there as well. Okay, next slide.
It's just
Yeah,
okay.
that's actually we actually cut some of our slides off because we actually have more slides. So that's actually our presentation this afternoon. Madam Speaker and members of the committee, with regards to our efforts in getting our enrolled providers as pods, our points of dispensing, the collaboration we have with regard to the guard working the platform, and on behalf of Public Health and Social Services. And as many of them have presented, really, we're really hoping the federal government will give us an increase in the number of vaccines we receive so we can reach that goal of herd immunity in July. It's my staff and I are here to address any concerns or questions and have a discussion regarding our COVID-19. Also open to your suggestions with regards to any thoughts or ideas you may have that we could become even more efficient in the COVID-19 response. Thank you very much, Madam Speaker, and members of the committee. And to all those represented from Public Health and Social Services, thank you. And to all our partners who are watching and listening, thank you all for the work we've done so far and the many months of work we have ahead of us. We look forward to your continued partnership. And of course, we couldn't get these numbers and this level of penetration without all the help of the people and the partners. So thank you, Madam Speaker. Members of the committee, Public Health and Social Services, of course, is here to discuss any further concerns or items of interest now. Thank you.
Thank you. Thank you very much, Director, Dr. Cabrera, Dr. Kaneshiro, all of the team, all of you. I know you're all working very hard together to get this vaccination rolled out for the people of Guam. That we're all trying to get to this goal of at least 70, hopefully 85%, like Dr. Fauci recommended, of our community to be vaccinated. So I'll just start there. We've got a great percentage of those 75 and older vaccinated so far, first dose, and a good percentage of second dose. But for those 60 and older, the percentage is I think 20-some percent, 27%. And I just wanted to know, are you worried that that percentage is low? The response is maybe not overwhelming. And are we going to get to our target at this rate? Or do we need to kind of do something different to motivate the 60 and older to be vaccinated? And I know you chose that number and you lowered it to 55 and older now based on morbidity rates, they said earlier. And so I appreciate that. Thank you for doing that. And if you could just speak to that altogether, how do you get, are you worried about getting to the target, a percentage for the 55 and older?
Well, Madam Speaker, with regards to our first subgroup of 60 and older, and then of course, as you noted, we decreased that age down to 55. But for the 60 and older, we've launched the Homebound community center testing concept, and we really believe that that would be one strong means to bringing in our 60 and older. In addition to the work that Dr. Kaneshiro and her team have done, we also know that as one of our partners is American Medical Center, AMC, and they've also assisted with the Tumaini Senior Citizen Center over the weekend, doing the vaccines as an option for those in the village of Tumaini, working with mayor in that village. They've also assisted with Mongmong Totamaiti. So we have a lot of confidence that with regard to our effort going into the community, working with target populations, working with the mayors, working with our aging service providers, and collaborating with them, we would be able to bring more of our 60-year-old and older seniors into the community center, the senior center. One of the things that we're looking at eventually, ma'am, should these numbers stay as encouraging as they are, is the eventual reopening of the Senior Citizen Center. We really want to promote that, and promote the idea that as they come in and get vaccinated, really is just one step closer to protecting them as well. So I think the community center, senior center approach that Dr. K is leading with our nurses, our homebound, our target groups within the community, Gometro and Koladad. They're also reaching out to working with GORA. There are several housing projects in our community that are dubbed called GORA 82, and we have Indedadil, Telefofo, and Agate, to name a few. And so they're also going to be collaborating with that group to reach out to that population now.
That was going to be my next question. So you've recently gone out in a rapid response to certain communities because you were afraid that they were at higher risk of obtaining COVID and you wanted to test them and educate them. Why are we not vaccinating them as well?
Actually, that is in the discussion, ma'am. We've made a major shift with our manpower, the Guam Guard is able to manage the UOG pod. And so now we're able to take our team of nurses. As you know, Madam Speaker, the same team is out there doing the rapid engagement team, doing the Binex testing, the same team that goes out and opens up the Okudo pods. We're really using the same team in all these different fronts. So now that we have the primary vaccine pod for the public over the University of Guam, managed by the Guam Guard, we're able to take our resources and now go out in the community. Tom Nadeau, our incident commander, Dr. Cabrera, and I have had separate conversations, and we're already looking at that possibility of not just doing rapid engagement for testing, but we're also now starting to explore the possibility and what it would take for us to also offer the vaccine as part of that whole engagement that we have when we go in the community. So that is in discussion. It hasn't been finalized just yet, but it is something that we've already started discussing in-house, Madam Speaker.
All right. All right. Yeah. So back to the nurses. That was one of the reasons why I wanted to have an oversight hearing, and it was just from the beginning. We all know that testing was crucial, tracing was crucial, and those two elements were going to get us back to hopefully opening up businesses and schools. Now that the vaccinations are available, it's equally important. So we've got our 3 prongs. And I'm afraid it sounds to me that, we've got the same people working these 3 prongs in public health. And so that's why I ask about number of employees, details of these employees, and how are you, protecting yourselves against, burnout, first of all. Second of all, how are the rest of public health's missions being completed if you've got personnel dedicated to these 3 responses, and in particular the nurses, if they are, expected to do testing and vaccinations, it seems like your schedule puts vaccinations on hold in order to do more testing, and it's like only one or the other that the public health nurses can do. If you could speak to that.
Sure. Let me speak, and then Zinnia would like to also add on to this. With regard to testing, actually, we have ongoing testing over at our community health center up in North. So if you are identified a close contact, or for a medical procedure that you need to take, or travel item that's required for you to have a PCR, that testing can still take place and continues to take place at the northern site. And so we do Binex testing right now. We're using that almost when we're not running a vaccine clinic. So it is the same team, you are correct. Many of them have different assignments, and depending on which activity or event we are working through. So some team members will be at all sites and some team members won't be, but I also know that Zinnia here is wanting to also share some thoughts about your inquiry, Madam Speaker.
All right.
So in regards to the nurses, we all have the same concerns because there's only so many nurses that we have. And we're trying to find ways to work smarter rather than harder. And so what we've done is we've actually expanded our workforce. And so an example is like with the Binex testing, we don't necessarily need a nurse to do the Binex testing. So we've done a lot of training of ancillary staff to provide that type of service. In regards to vaccination, we're fortunate to reach out to all our other nursing colleagues. So we've reached out to the University of Guam. We get a lot of students, and it's kind of working well because they can't get the number of hours that they need for their clinicals. So they are able to get it during the outreach that we have with our mass testing and also our mass vaccinations. So we're also reaching out to the Guam Nurses Association. So if you see like pictures, you'll see a lot of them coming out and helping not just with our pods, but also with the gum. So we're trying to think out or look out of the box and just grab as many nurses as we can. We've also reached out to retired nurses, GCC. We're looking at all our other partners like social workers, MAs, CNAs, just others that we can train that are healthcare certified, but not necessarily nurses. So we're looking at all the scope of practices that they can fall under. So it's not necessarily a nurse that we would use for all these other services.
Thank you, Inia. I've met a lot of them and they've told me that they are volunteering, some of these nurses who work in other places, but are you able to compensate, let's say, retired nurses who want to come back to help vaccinate?
Yes. We actually hired a couple of retired nurses, so they're on board with us. And then another group of nurses is the GDOE nurses.
Right.
As if you can remember, they actually went back to GDOE, but they were released back to us, and we have them like Monday, Tuesdays, and Fridays. So we're working our schedule around the nurses' schedule so that we have, we know where our pool of nurses are, and we can increase our testing capacity and our vaccinations.
And what about CNAs? It's my understanding that we recently, you recently, or UOG in conjunction with Public Health, trained CNAs, but that they are not all hired. Is that correct? Are they able to do these things?
Under the TNAP program, they were hired at GMH, GRMC. We're looking at hiring 5 for public health. So it's just a matter of the pool and where they decided to go for hiring. So I'm working with HR to see how we can get the 5 CNAs that are interested in working with public health. And there are more. We have the Mariana Training Center as well that has reached out. So they want to provide some of their students.
Yes, and are they able to do testing?
Yes, they are. And Madam Chair, according to our National Nursing Council, they're having the same problem nationwide. And so they've expanded the ability for healthcare providers to give vaccinations. So it's not it's not just doctors and nurses that can give vaccinations, but they've expanded the workforce as long as they're trained. So you can train dentists, you can train optometrists, you can train any kind of healthcare provider, pharmacists as well. If they're interested, we're willing to train, and we're actually reaching out to them to help with our pods.
Okay, so I've heard you've done some outreach for, that dentists have been volunteering, and of course the pharmacists are going to be stood up to also provide vaccinations. So I'm just going to announce, anyone interested, please contact the Director of Public Health to volunteer your services.
Thank you, Madam Chair. Madam Speaker.
Annette, did you have your hand up? Sorry.
Yes, ma'am. I just wanted to add several points. Sorry. There's also been volunteers from Naval Hospital nurses have come out to our pods at Ukuru. So again, we could, all the support is greatly appreciated and needed. I'd like to point out your question in regards to the ones who are 60 to 74, that they're slightly lower in their percentage for dose 2. This week, we are actually looking at just over 4,000 individuals are due for dose 2. So the Guard has really stepped up this week. There are a few days this week that they are looking at over 1,200 individuals that they will immunize. And so that's for both the Pfizer and the Moderna vaccine. And that would be in that population of 60 to 74 years of age who are now due for their dose 2. So we are expecting that percentage of penetration to that population to increase. And I'd also like to point out that the enrolled providers, of the 42 enrolled providers, 28 of the private providers are new partners for public health. We have our routine child and adult immunization program, which is a smaller group of individuals. So by having this much support from our private sector, this will also help give public health that break, like you say, the concern of burnout, because this will allow our residents to have more opportunity. Rexall Drugs has already been providing vaccines. Other pharmacies are going to be providing it from their own facility, as well as numerous private providers, multi-specialty, 1 or 2 provider practices. So again, we do appreciate all the support and the partnership that we are getting in response to this COVID vaccination campaign. Thank you, Madam Speaker.
Thank you. Glad to hear. How soon will you get to the dialysis patients? Is that so the Homebound looks like it might be completed by the 19th. And then I read somewhere that you're going to do another round for anyone that you did not get on the first list from the mayors. So when will you be able to get to the dialysis patients?
Actually, this week, ma'am, we look at I believe it's today was their final with the temperature and last checking off on the required list. And so we hope to be able to distribute out to them within this week, ma'am.
Dr. Cabrera, can we just put it on the record? Can you just say it again, why you have prioritized 55 and older and dialysis patients, please? And the homebound, I mean, all of these people, why are they prioritized for vaccination?
Sure. So starting first with the age of 55 and older. So just that, first of all, for just that 5 years, that represents about 9,000 people on Guam. And so that was also part of what was in consideration when we went to 60 and then 55, for example. But when you look at our first 100 deaths here on Guam, what you see is a significant jump in the mortality rate in particular, going from the ages, yeah, they slowly go up, but then all of a sudden between the 50 and 54-year-olds to 50 to 55, and then up, if you're getting a quadruple in terms of relative risk ratios. So that was pretty significant. And in fact, when you look back at even our more recent past 6 deaths or so, they've all been fairly young. We're talking about majority of them in their 50s and late 40s, and of course our most recent one being 18 years old. But that's a separate matter. So that's part of that reason, that rationale again, in that we want to do the most. Excuse me. We want to do the most that we can to save as many lives as we can, and in a way that provides a balance as well. Now, for the homeless groups, for example, these are the at-risk groups that are considered at risk, not just because of their socioeconomic status, but also their living conditions. And so that was a justifiable reason for them as well. And then, I'm sorry, what was the last one you asked for clarification?
I think dialysis.
Oh yeah, the dialysis. So dialysis patients, it's not specifically because they're dialysis. It's just that they still have to meet the eligibility. But then they had the option of getting their vaccine at the dialysis center once they become a provider. Otherwise, they can still get the vaccines in other pods that are available. But to that question is also why the other main group that we recently, when I say we, this is the VAPPC, had approved us for those that were hospitalized and have a significant comorbidity, and to get their vaccination upon discharge. Again, these are the patients that are the most vulnerable on the island, the high likelihood of a bounce back, so to speak. And so they were added to the group. So those are the groups. So they are 16 to 54 now that can get it if they meet just that criteria by itself.
Thank you, Dr. Cabrera. And I just wanted you to emphasize that because I'm going to say from my own personal experience that I didn't think I needed the vaccine necessarily. But when I heard the statistics about 55 and older and how they were at higher risk of morbidity on Guam in particular, that convinced me that that those numbers are not lying. And so I'm hoping that will help to convince others who are listening as well. And so I did get myself vaccinated this weekend. So thank you. And I'm going to open it up now to questions from my colleagues regarding vaccinations in particular. I'll begin with Senator Joanne Brown.
Thank you very much, Madam Speaker, and certainly to the panel and all the participants from Public Health. I know it's been a long day and a long year since we had to deal and wrestle with this pandemic. I just wanted to get your feedback. I know a lot of efforts are being made, certainly to get the outreach to the community. And myself, I took my mom up to the UOG field house about a week and a half ago. And I have to tell you, from the nightmare comments that were initially being made for everyone in line at Ukadu for 5 or 6 hours, it was a tremendous improvement. The process flowed very well, and in terms of outlining what we needed to do, being there and being able to get the vaccine shot, and then, the period of observation that was needed for everyone getting the shot to make sure they were doing okay before they left. So I have to commend you on that effort. I know that this is not something we do every day, and thank goodness it's not. That this pandemic is something in our lifetime that's a bit different. But I just want to know what more outreach is being done. I know you're making every effort you can for Homebound and others, but how about a message for those perhaps that are maybe still a bit hesitant in getting the vaccine? How can we get outreach to individuals that might be concerned about that in terms of being able to get the vaccine and take the vaccine?
Senator, I'll leave this definitely open to others to contribute, but I do know that there were two ideas. One is the message and one was an approach. And one of the messages we're looking at is having a public service announcement of individuals within this age group who have come forth, or perhaps maybe members in that community that are community leaders, and not necessarily all community leaders, to come out and express that they've taken the vaccine, why they've taken the shot, and encourage their colleagues, their peers to do so. And one of the other ideas, and we were looking this at the pod and we discussed this, was looking at a morning time frame for seniors. We all recognize seniors like to get up early.
Yes.
And so we're thinking maybe we do 7 a.m. to 9 or 10 in the morning at the university. So now that they're hearing these lines aren't 3-4 hours, 5 hours long, there's been a significant improvement with using a registration process, a scheduling system of sort. And so that has really removed that. So we're looking at that messaging possibility and also a morning time frame just for seniors. And the idea here is you come in and you don't have to pre-register. And we're just discussing this with our guard partner for them to look at that. And they're actually, I think, very receptive. I was not able to make this morning's meeting, so I don't know if there's any more traction on that. I don't know if our deputy doing this has any information on traction on that discussion point that was discussed in a prior planning meeting with regards to working with the guard and being able to do that. And so those are the 2 points I wanted to share. I don't know if anyone else has maybe some thoughts or response for Senator Brown. Thank you, ma'am.
I could just add real quick that one of the things that we have been doing is having multiple town halls for a variety of different groups, one in the general public and then into as different organizations have requested of us. This includes the chamber, it includes the even the FSM community and their leadership. And so we've actually made as many, and also with school-based staff as well. But we feel that that's only the tip of the iceberg for the most part. And for example, when we're talking about 87% penetration into the 75 years and older, then it begs the question: who are those 13% that don't want to get the vaccine? And in all likelihood, it's the very marginalized population. It's in all likelihood communities where there's already an inherent low medical literacy. And based on a lot of the interviews that we've had, it comes down to even as the basic question is, do you know what a vaccine is? And you'd be surprised how many of them don't know what a vaccine is and what's the whole purpose of a vaccine in terms of prevention. And there's a common misperception that it's for treatment. And they say, I don't have COVID, why do I need a vaccine? And so it really comes down to understanding this and speaking with our partners in these areas and really speaking to everyone on this call right now that for your ideas, and that I'm sure there's things that you can probably think of that we probably never even crossed our minds. So we definitely look for suggestions and other recommendations. Thank you.
Look at the chat. Hit chat. Look, you can hit chat. Let's see what the chat is.
Thank you. Senator?
Yes, Madam Speaker, I just wanted to ask one other question. I know they were mentioning hopefully towards the later in this year being able to maybe get up to 75% in terms of members of our population that are vaccinated. How do they see the trend so far? I know we went from the older population, now we're up to 55 and above, but are they seeing the numbers consistent? I know they mentioned they had about like 764 plus on an average day, but are they seeing, how is the trend looking? Are we getting more people coming in, or is it slowing down? And are they comfortable that at this rate, we're going to be able to reach that level later this year? That's my last question, Madam Speaker.
Thank you.
I think I mentioned.
Annette, again, Senator Brown. we've seen a pretty good response to as we expanded the age groups. There are some people who were hesitant in the beginning, and then after the first 2 weeks or so of the vaccination campaign, and they saw that, you know, a lot of their family and friends were getting it, relatively minimal issues with side effects, that okay, now I'm gonna get it. You know, even in our healthcare personnel, some of them didn't take it for the first month, and then as they saw that more and more of our residents were getting, they built that confidence and they came out to get the vaccination, despite the fact that they're the front line and they're most at risk due to their line of work. So again, it's definitely the messaging. We will definitely work with all our community-based partners, faith-based partners, to get that message out that the vaccine is safe. You know, we are prioritizing the most at risk due to exposure or you know, the age or medical condition, and that it's safe, and that, you know, it's one way of helping us flatten that curve and to protect you, but also to protect your loved ones and others around you, especially those who can't get it, those below 16 years of age, those who are pregnant, you know, or are allergic to it. So again, we want to build that a community immunity basically, and just have to keep reinforcing that message out to the public, and working with our partners to reach as many residents as possible based on the eligibility, specifically like the age, ma'am.
Okay, thank you. Thank you very much, Madam Speaker.
Thank you,
Senator,
Senator.
I'm sorry, Madam Speaker, if I may further add to that. As you probably noticed, a lot of our flyers, we announced that it's a second dose, but we continue to see a lot of people seeking their first dose. So I think that says that there are still people in our community that want to get vaccinated. It's just a matter of getting the opportunity or the convenience to come in to get a vaccination. So we're confident, optimistic. There are several people still in our community wanting to get vaccinated. It's just now a matter of opening it to them and also having the vaccines available to them.
Right.
Thank you. Thank you, Mr. Nadeau. Senator Moylan on the vaccination.
Thank you, Madam Speaker. On the vaccination, Director, there, I'm in copy of an email from another doctor just questioning the use of Band X used out on the community test which is supposed to be done with those folks with symptoms, but they're using it on those without even any symptoms. And on the flyer, even on the flyer, it says no need to have any symptoms. But the quarantine hotel, we're using PCR tests, which is, according to the writer here, discriminatory because it's super sensitive test that will pick up past infections, not current infections. So they're questioning the use of the one test versus the other. Can you comment on that, please?
Yeah. Actually, Senator Moylan, what I'll do is that question was raised, and I had our Chief Medical Officer, Dr. Cabrera, respond to that. So in keeping with that, I'll go ahead and have Dr. Cabrera respond to the use of the Binax versus the PCR, because we are doing the community testing using the Binax system and that platform. Dr. Cabrera?
Yeah, sure, absolutely. Yes, Senator Moylan. So to your question about about the testing. So first of all, the Binax testing is an antigen test, and so that's different than the PCR, which is a molecular test. The key thing with the reason why I understand why the reason that this question was raised. In fact, we during a call with the then Surgeon General, Dr. Jerome Adams, and Dr. Deborah Birx, who was the former White House COVID coordinator. So this was just in November, late November, that we had this call. And I asked that specific question to Dr. Birx in particular, and her response was very clear. She's like, this is a situation where the FDA had to release their emergency use authorization language based on how the FDA application was submitted and based on the data that was submitted. So that's a long story short of saying that that's the parameters in which they gave the EUA. But as we know, that there's off-label ways of using different tests and medications that providers can do if they feel that they have enough understanding about the risk and benefits of that. Now, antigen testing, one of the key powerful parts of antigen testing, even though it may not be as sensitive as PCR, is that it correlates very nicely with how infectious you are. So not just that you're infected, because if you're infected and you may not be that infectious, but the PCR will catch it. But if your antigen test is positive, then you're very likely to be very infectious, even if you don't have symptoms. And so that's the key part of that test, and that's the key advantage of it. So in fact, when it's being brought up as a disadvantage, it's somebody who's not looking at it from the other side of the coin. And so that's the reason why it's important to use. However, it is definitely more useful if it's done in serial fashion. If it's a group that's done and you're testing them, they're asymptomatic and you're testing them on a once a week, twice a week, and what have you. And so it would be nice if we could have this more available and use it more. But at this point, with our resources, it's better than nothing for these easier community-based drives. Now for the quarantine, it's not completely true. There is a mix of both the PCR and the antigen testing that's being used. It just depends on how resources are being balanced. So it is a mix in that sense. But for the most part, it is PCR. And here's why it's very important that we use as much PCR for the quarantine, is because we do not want any of these strains to enter this island. God forbid that it already has entered in. And so therefore we have to use the most sensitive test in that fashion. So it's a balance. There's no perfect answer for this. And it's a best judgment that we as a group have made to move on. But we are continuing to revisit it. And as more data comes out, which is actually supporting our current position, but we will continue to reevaluate as the more information comes out. Thank you.
Okay, thank you, Dr. Cabrera. Another question is, so I see the nation is recognizing us of the good efforts of the department here and everybody getting their vaccination, and that we're way up there on the ladder. So that's a great thing. So I understand we're trying to get additional vaccines. So we want to double our numbers. Are we finding any resistance from that, or have they told us that yes, they will support and send us twice as many as we asked, as they gave us from before?
Well, with regard to the request, it's simply that, Senator Moylan, it's a request. We have not received confirmation that they will increase. There was a conversation about 2-3 weeks ago we had with Colonel Schenkel, and he remains involved with what was once called Operation Warp Speed, which is the lead entity with regards to the vaccine allocation distribution. So we have made a request more than once to increase our vaccine allocation to Guam. We're hoping to get at least upwards of 40,000 doses per month. But at this point, we do not have anything confirmed. Basically, it's really coming down to production, what's available, and also with regards to being equitable in the distribution of the vaccines. We are trying to make our point that we are 168, and really it's a small part of the allocation if you look from the big picture. But of course, we're not the only one perhaps who's asking. Other states are also asking for their population as well. But we're really trying to market the idea and promote the idea that we are a manageable community. We are vulnerable as well, being where we are up here. And we can do herd immunity by July, that you're protecting a community that could be very, very vulnerable with regards to our resources, unlike other places. But as I say that also, I recognize and balance the fact that there are many challenges also that's going on in the U.S. with regards to their own situation, with recent improvements that have been reported in the news, but nonetheless, they too have their challenges. But we have asked, we have not received confirmation that we will receive more at this time.
Thank you, Director. And just my last question, Madam Speaker, on the vaccination. So I'm just wondering how we're doing with our PCOR restrictions and reducing those restrictions. Dr. Cabrera, I understand that the hospitalization is looking really good. The CAR score is really good, and you told us how long it's been really looking really good. And we used to hear a number of 1.5, and now we're way below that. Are we waiting for like a 70% of vaccination or reaching the herd immunity before we reduce our PCOR restrictions, or is there going to be something that we can see happening here in the future?
I'll just say that ultimately, as we all know, that decision rests with the governor in terms of moving toward PCOR levels. But Usually we want that to come with different milestones, which is specific to what, what gets, what mitigation efforts are being lifted. So I'll just say that, but we've only been in Peak Core 2 now for, for about 2 weeks now, or a little bit over 2 weeks. And so not a lot of time has passed since then. And so and then I think now with, again, the extreme worry we have about these strains, if they are here on island, how much quicker they could actually spread. I think it's a lot of a wait and see approach to see how that might really change things. That could be the real, it could really change the rate that things spread here and the effectiveness of our current mitigations right now. And so I think doing anything too fast is gonna maybe prove to be very deadly for us. And so we have to, of course, be very cautious with that.
Thank you, Doctor. Thank you, Madam Speaker.
Thank you, Senator. Senator Taitigui, you are recognized on the vaccine.
Thank you, Madam Speaker, for the opportunity. And thank you so much for all the information you provided our colleagues here. And there's even a 128-page vaccine plan that has a wealth of information. So thank you. I haven't had a chance to read all of it, but I will do for sure. So I'm just going to try and get this as fast as I can because I have several questions. Dr. Cabrera, why are individuals with comorbidities, regardless of their age, not being prioritized with COVID-19 vaccines? People like who has asthmatic issues, heart conditions, or even cancer, who are in the ages of maybe 30 to even 40.
So the quick answer to that is that the biggest comorbidity you have that's related to COVID-related deaths is your age. And so that's what we had to start with first. And that's what the CDC and the whole country recognized. So that's why the 75 years and older was first the focus. And then as we moved down, we started introducing, but overall, it's something that we do want to be able to get to. And we're doing it in a fashion that can balance with our actual vaccine supply.
Are the areas in which you've allowed like pharmacies, other medical facilities, allowed to give vaccines to individuals who come in there that are below the age of 55, who have these, like a cancer patient, for instance, or a person with heart attack? Will they be allowed to do it, or are they on strict regulations to only go to those who are 55 and up?
This is, they're under strict instructions and directions and orders to only give to those who are eligible. And with the very, extremely rare occasion where it's a situation where the vaccine will go into the trash as opposed to an arm. And then that's when it goes to anybody who's supposed to and available and willing.
With the, Annette, you mentioned earlier, oh, and by the way, well, I'll just save it for the end, but about all the vaccines that you're doing, all the hard work. I feel like I know you now with all these public oversight hearings, and you're very well versed, and thank you for that information. But DOC inmates as well as officers, have you taken care of those areas since it's so confined? And I know we had some issues with officers there, but what about the inmates? Are they given the vaccine regardless of age, or is that going by an age group too?
It's going by age group, ma'am, and we have yet to really expand to the inmates. And again, they did have that big outbreak within their facility. And so as recommended from CDC, is anyone who's had the COVID infection, the disease, that they have some form of immunity for at least 90 days. So due to the limited amount of vaccines that are available to a jurisdiction, we want to prioritize and give those limited doses to individuals who have no form of protection. And then after the 90 days have passed for individuals with a past infection, then we'll offer the vaccines to those individuals. So we're trying to balance those who have the natural immunity because of recent infection, and to those who have no form of immunity to provide them the vaccine, ma'am. But yes, the DOC will be down the road, ma'am.
Okay, I see. So, but you are doing it based on age, and as far as like DOC. Is that also pertaining to the military and the military retirees? Do they come to the University of Guam to get their vaccine? Do they line up like everyone else, or does DOD have their own vaccinations on base?
Yes, DOD has right now for their active duty personnel. They were able to get limited supplies to our Guam National Guard. And then for the VA, they are one of our providers that we are onboarding. So our military veterans and retirees can avail of the services that we were offering at Ukuru, at Southern, and now at University of Guam. And then if they're eligible due to the Homebound program, or as we're going out now to the senior centers, ma'am, we will provide it as well to those military retirees and veterans, ma'am.
So when you said National Guard as well as DOD, that the military has their vaccine, they're not doing it by age. They're just doing it by individuals that are there, right? I mean, for them.
With the military, their priority was their active duty personnel. And again, they receive limited doses as well. And so they have their prioritization. They did provide some to our Guard members. And again, not as much as we had initially hoped. So their allocation too is similar, where it's what they get on a monthly basis is what each jurisdiction or entity has to prioritize, ma'am. Dr. Cabrera?
Oh, thank you. And the vaccines that are coming in, the Moderna as well as the Pfizer, are you guys anticipating the Johnson & Johnson vaccine coming in as well?
Yes, if it receives US FDA EUA approval, and then we still have to wait for US CDC and the Advisory Committee on Immunization Practices to make their recommendations and for CDC to approve it. Once that happens, ma'am, then CDC will have that made available to jurisdictions to order on a monthly basis as well.
Okay, I think Dr. Cabrera, you answered the question as far as the new strain being reported on Guam as of today. So you're saying right now have been no reports of the new strain of this COVID, and this new strain will be able to, or the vaccine that we have, the Moderna as well as the Pfizer, would be able to protect ourselves from this new strain.
So before I answer the strain question, I just want to just make one quick clarification about DOD. Is that there's no such thing as herd immunity inside the gate and outside the gate. It's herd immunity in Guam, as we know, right? That has to be the goal. And so we're not technically counting right now DOD's vaccination numbers. That's another extra credit, so to speak. But just so for everyone's edification, they've vaccinated around 3,000 of their personnel already with the first dose. And so we're not even counting that in Guam's total numbers. So it makes it, but because like Bloomberg and the CDC's count military as DOD as a separate entity in terms of the rate, so we're keeping the count separate for now. But practicality, it's that of course we all mix, so it matters. So to your question about the strains, now as we know, there's multiple different strains that are of concern. The UK variant, the South African variant, and the Brazil variant. And so right now there is confidence in that, particularly the Moderna and the Pfizer should offer us enough immunity to these strains and without much change. There is a little bit concern about the Johnson & Johnson vaccine in that it probably offers much less immunity for, in particular, the South African strain. So there is a little bit concern about that, but right now that's why this is a race to vaccinate before before the strain, if it ever gets introduced in the community. If we have enough people vaccinated, it shouldn't become a factor, and we should be comfortable with its effectiveness. As for the identifying it, so we are sending, the CDC has allowed us to send them samples for sequencing, for genomic sequencing, and that's how you identify. Now, these are very specialized tests using very specialized labs. And so we sent our first 20 samples last week, Wednesday. And so that was 10 from the community, random samples from the community, including parts of December and January, and then 10 more from the QFAC. And so it's a surveillance, and then moving forward, we'll be sending samples every 2 weeks as a continuous surveillance to see if it's ever been introduced. And as we know, Hawaii already has the strain.
Okay. Yeah, thank you so much for that. And Director San Agustin, are you working with the Guam Hotel Restaurant Association for a certain type of program specifically to help them open the tourism industry? Are you working with them, or you're still staying on the course of vaccinating at the University of Guam, et cetera, down the line?
Actually, we're working with Mary Rhodes from Guam Hotel Restaurant Association on a project for the eventual opening of the hotel industry. Chima and I and a few others of public health, the team have met with her. She's putting a plan together, and she and I are probably going to meet later this week, I anticipate. And so that we'll revisit where she's at. She's put a plan together, I'm pretty certain right now, and we just had to sit down and see how that's all going to play out.
So nothing in the nothing right now. Then it's just still in the making. And just one more question I have with regards to those individuals who are visiting Guam. I guess it was in the paper. Annette, those who don't have a Guam ID will not be able to get vaccinated. Is that correct?
Yes, ma'am. Due to the limited vaccine supply, we are prioritizing our residents only, ma'am.
So then they must have a Guam ID, because we were told that when I took my father there, he didn't have one. He actually brought his passport, and they let him go. So I just, for the public and everybody, people are coming to Guam. Some people are actually coming to Guam just to get the vaccine, because in the States they can't seem to get it. So that's anyways. So Guam ID, correct? Just so that the public who's listening, not a passport, but a Guam ID, right?
Well, the passport, ma'am, as well as if they have another form of identification to show that they are like a resident, or they are like H-1B, that they are working here on Guam, that we will take. So we're trying to screen them out to ensure that they are residing on Guam. They are here on Guam to work. They're not just visiting. I know in the past, we also had an individual who was just here for a week for work purposes, but just for a week. And so unfortunately, we clarified for that individual that due to limited supply, our priority is our residents of Guam.
Well, I greatly appreciate all the work that you're doing. I think I've started this, taking my father down to Okadu, and then watching the second phase of the second shot was done much better. It was a lot more smooth. I know Annette, especially someone like you, is not getting very much sleep these days. And I just want to let you know that we're greatly, greatly appreciated to all the people at Public Health. My son had COVID. He's in Arizona. He was contacted. He's a paramedic, actually. And he didn't tell me until he was cleared and back to work before he called me to tell me he had COVID, so I wouldn't worry. But it was ironic because he received the shot that day, and the next day he was diagnosed with COVID. So I think something came about where he had it, maybe he had it already and the shot, but he's still told, I mean, Dr. Cabrera, he should still take the second shot, correct? He already took the first one, but he had gotten it. I guess it was like simultaneously.
Yeah, the shot does not cause COVID. First and foremost, it's impossible to do that. But yeah, no likelihood he had already contracted it. But he still has to wait that 2-week period of being cleared from having been ill from COVID. But then he can be eligible to get his second shot. And the CDC currently does not make any recommendations that say you shouldn't get your second shot. You should if you already started the series.
If you already started the series. Okay, so I thank you again so much. Thank you, Madam Chair. Sorry, it was kind of lengthy, a lot of questions.
Thank you, Senator. Thank you. All right, Senator Ada, and then Senator Blas. Senator Ada.
Thank you, Madam Chair. Just to go off Senator Taitagui, and then, with Annette mentioning we're prioritizing our residents, yes, the article is very concerning because I just heard Dr. Cabrera talk about herd immunity, race to vaccinate. Inside, outside the gate. So the question, is the screening process a federal process or a local one?
Screening for to come into the pods, or is a local process?
Receive the vaccination, right? So does the federal guidance for COVID vaccine distribution prohibit administering the vaccine to non-U.S. non-resident?
No, sir.
No, it doesn't. Okay, so when I'm looking at the article, and it says, according to the article, the Fieldhouse Clinic, which is operated by the Guam National Guard, checks patients for residency as part of the screening process to ensure they have some form of local identification card, Carrera said. Even if they are green card holders, they qualify, she said. So here's the question. is this done at all the clinics where the vaccines are distributed?
Yes, we screen at our pods that Public Health has done, sir, at Ukuru as well as First Southern.
Yeah, but at the clinics, are the clinics screening for residency as well?
The clinics are taking their known clients, sir. So I could not speak for them, but they're scheduling based on their patient listing that they have established patients, sir.
So we're not going to be in jeopardy of losing vaccinations or federal funding because we're not being equally doing the vaccinations equally, are we?
No, sir. Each jurisdiction has those similar concerns that they do not have enough vaccines for their residents. I know colleagues in the mainland, the concern, especially those who are, with bordering states. I've heard some articles that they've come from other areas and that, it's shorted their own residents. And so again, that's something that is a concern, not just international or regardless if you're a US citizen or not, sir. It's not about citizenship, it's about residency. And again, because we do not even have enough for our own residents. And so we want to make sure to prioritize them for our limited supply. But no, there will be no penalty if we end up offering it to someone who is a non-resident. But again, locally, we want to prioritize our residents because we do not have enough to begin with.
Yeah. So, but the question was, is there a penalty for not giving the vaccine to a non-resident or a non-US?
No, sir. No penalty.
There's no penalty.
No penalty.
And we're sure on that.
Yes, sir.
Okay.
The biggest concern is the recommendation based on like age, that we're giving it to those who meet the US CDC and the ACIP recommendations. We do not want to go off script from that.
Okay. Thank you, Madam Chair. I'll reserve other questions for later on.
Hello, Senator. I think I got disconnected for a little while. Are you done, Senator Ada?
Yes, Madam Chair. I'll reserve any other questions for later on.
Okay, thank you very much. Senator Blas, you're recognized on the vaccination.
Thank you, Madam Chair, Madam Speaker, and to the staff and to Public Health, Dr. Cabrera and Mr. San Augustine, thank you very much for being here with us tonight. One of the things that I've heard, and first off, based on our current population, and you said you wanted at least 70% is your goal. And then you also mentioned you wanted basically a herd rate or herd immunity. What is that herd immunity number if we're looking at 170,000 people?
Table you have? Yeah. Yeah, or you can bring it on our side. Senator Blas, we have a table. We're just going to pull it up so we give you the numbers that we already have. And while we're waiting for that, may I offer just a piece of information? Earlier, there was an inquiry about the DOC officers, and I know that we were working with law enforcement, and so I just wanted to verify the information, Madam Speaker, before we shared it with the rest of the committee and yourself. And so the officers that were interested in being vaccinated, being given the shot, were asked and were vaccinated from DOC. So for those that did want it, we did work with them. And we scheduled them at one of our pods or the hospital or one of the pods that we are partnered with. And so they have been vaccinated based on those that were interested. So I'm just getting a message right now. I think they're saying about 37 of the officers have been vaccinated of the 50 that were asked. We'll continue to work with DOC on that, but I just wanted to share that piece of information.
Okay.
Yeah. Based on the 168.
Yeah. So 117,825 doses needed to obtain 70% vaccination.
So 117,000, give or take, right?
Right.
At the current allocation rate, and you said that you wanted to reach this by July. At the current allocation rate that we have, and let's say that you don't get any authorization for additional, or you don't get an additional, how many vaccinations are we talking about that we're going to be able to get?
Sorry, I just need to clarify.
Sure.
Senator Blas, it's actually right now based on, there's a slide Dr. Cabrera provided, because the vaccine is not authorized for anyone less than 16 years of age.
Yes.
We have to go to the lower population. So actually the target, if I remember correctly from Dr. Cabrera's slide, it's approximately 100,000 individuals who are 16 years of age and older to reach that 70% for herd immunity.
Okay,
And
so let's go with that figure. Okay, so 100,000, 70%, 70,000. What is the current allocation, based on our current allocation rate, how many vaccines are you gonna get by July?
So I can answer this. So just to be, sorry, I know we're throwing out a lot of numbers here, but actually it's 125,000 persons who are 16 years and old. 80% of that is 100,000, just to use a nice round number.
Okay.
So you would have to vaccinate 200,000. But to your ultimate question, Senator Blas, is that we are not going to make it to July with our current allocation. And that, again, was the statement about the federal government being the rate limiting step, not us. And so for us to achieve it, they have to step forward and they have to come up and give it to us. And that's why we're trying to make the strong argument that we're not like these other states where there's vaccines sitting on the shelf and just not getting into arms. We are putting them into arms, so give them to us. And let's have the United States have a big win with the Mariana Islands, and where we're actually going to achieve herd immunity before any other jurisdiction. So we're trying to make that very strong argument. The governor's having the discussion directly with General Perna to request for these allocations. And so that's what we're really hoping. And if anyone and the senators have any other connections in federal government as well to make the same plea for us, that'd be greatly appreciated, because that's the honest truth. And that we, at our current rate, we'll be lucky to if we're not being allocated any more than we currently are, we'll be lucky to reach it by the end of the year.
Okay, so what is that number? That's why I'm asking you. You want to see if you can attain this by July, but if nothing else moved in as far as allocation, how many vaccinations are you expected to receive by July?
Right now, what most we got, the senator, was 51,300 for 3 months. What is that about?
17,000.
17,100 average. Yeah, but what we're hearing, Senator Blas, is that they're going to increase production, and so that's what we've been anticipating. And so we're hoping in the coming month or so that we will actually see an increase to Guam's allocation for vaccines. We're working with the idea that if it is 100,000 and through July, how many vaccines? And so there is an ask for Guam. I think it was like 40,000 in our communications or so with regard to doses, so that we could try to achieve the July, completely projected date in July. But I don't know, Vanette, if you have anything tracking on the VTREX system, if there's any indication of what the March allocation is looking like. Do you have anything at this point? Is there any indication?
No, so unfortunately not. We have not seen what will be our March allocation.
Yeah.
But we're hoping with the addition of the Johnson & Johnson vaccine, that will add more doses made available to all the jurisdictions. So, that's something that we can hope for. And again, the request that our director as well as the governor has put out to General Perna for the 40,000 additional per month, that we hope we can get a positive response, sir.
Okay, so let me go back to again the part of the first question that I had. Okay, what is that herd immunity number? If you're saying, let's base it again on your 125, I guess you want your herd immunity within that population of 25,000 of those above 16 years of age, right? So what is that herd immunity number?
100,000.
100,000. So even at 100,000, you want to get herd immunity 100,000. Right now, you're looking at if no further allocations, you're looking at about what, 40,000?
So we're looking at by July, if we're getting the allocation rate we're getting right now, we would get approximately 136,000 vaccines.
Okay.
And then that divided by 2, that's only 68,000 persons we could fully vaccinate.
Okay.
Sorry.
My next question, and I remember several weeks ago there was this whole concern about within the veterans community and the VA telling basically the veterans, you're going to get it from outside providers, and then there was some news report about that the veterans community, instead of going to the CBOC and to Naval Hospital or whatever, that they would need to get it, and there was some arrangement with public health. I'm probably paraphrasing or probably heard it wrong, but what's as far as veterans community, are we separating this out, or is this inclusive? Or what's going on there?
Unfortunately, sir, when all the planning was happening, and again, this was also at the federal level, there was a lot of unknowns that even at the DOD and federal level, what entities like federal agencies would be covered with like the DOD allotment. And so again, things were changing so rapidly as we were preparing to launch our COVID-19 vaccination campaign. At one point, it was the federal VA clinic or VA administration would be able to provide the different VA clinics throughout the nation with their own allotment. Then I know that had slightly changed. Then it was going to fall to the local jurisdictions to provide out of their allotments to the veterans. And so I know just recently, like as recent as last week, there was a question whether Annette, can you talk to the VA clinic in Hawaii and something about the Guam allotment. Unfortunately, I do not have that authority or the power to go to the VA clinic in Hawaii to release Guam's allotment. That again, that's at a federal entity, not my side. I can only speak for what Guam will get through the CDC allotments on our monthly basis. But again, we are now working again with our VA clinic. So I know it kind of put them in a limbo. Should they enroll with us or don't enroll in with us, because they were thinking they were going to get from the federal allotment on their own. But now we are working with the VA clinic to enroll them so that they can avail of our local jurisdiction's allotment. And again, while we're getting them on board and the QA process and everything, as we do with any provider, public or private, our veterans who are eligible can go to like the UOG pod, or again, as we push out to the Homebound or to the senior centers at the village level, they can avail of those services there, sir.
Okay, and I appreciate that, but there's a couple concerning things. First off, Hawaii VA holding off the allotment for Guam. That's one. Secondly, and it goes to the concern that Senator Tello and Senator Toniata had. I don't know if the Veterans Administration has this, where we, of course, protecting the resources that we have for our community, that they also had the residency and the age requirement for their veteran population, and that may cause issue. So I appreciate that you're on top of it, and maybe we need to look into that a little bit more, because if you have a veteran that's going to be coming in, let's say this veteran is 36 years of age and has this comorbidities and doesn't have a Guam residency address, but obviously stays on Guam, then what? Okay, I just don't want us to get into that quagmire of not being able to provide it when we should have provided it, when it could have been provided. Okay, so I appreciate that. A couple more questions, then I'm done. Sorry, Madam Speaker. With the COVID-19 vaccinations now, okay, and a lot of times it's used in comparison to try to allay some of the fears. It's like the flu shot. My concern now that I have is, okay, is this going to require subsequent immunizations or vaccinations like the flu shot, for your COVID-19 version 2021 or 2022?
So I can take that answer.
Yeah.
Question. So basically, the honest answer is we don't know the answer, and that we don't have data for it right now. But from what we know from existing vaccines is that this is in all likelihood going to be, it's not going to be like a 1-year booster, like you get it every 1 year, because that's going to be highly dependent on a lot of different factors. But that's what the thought is, that at worst, it's a booster shot once a year, just like the flu shot. But the odds are that it's not even going to require that.
Okay, well, I mean, this goes then to the last, maybe not question, so much a question, but a suggestion, because I heard earlier that one of the concerns that you had is down the road, there may be a loss of interest in being able to get this, and it could be as a number of different factors. One of them is fears. Okay, and one of the things that we all face, in all facets of our life, is the power of Facebook and the power of Instagram and Twitter. Okay, and all the the gospel truths that exist in these areas, and maybe as a suggestion for your messaging is that you can also message to allay some of the fears that people may have or the misconceptions that people may have. I've heard over the last couple of months, I've heard all these fears. One, you can't take it when you're pregnant. You can't take it when you had asthma. You can't take it if you had an anaphylactic shock. All of this, and I will tell you, there's one individual that I know wants to be able to take it, but fears it because this person heard that if they had anaphylactic shock, which they did, they shouldn't be able to take this, and so that stopped them. So if you part of your messaging can be part to allay the fears that people have about this, that would help tremendously with this. Okay, so this is a suggestion. So with that, Madam Speaker, thank you for the opportunity, and guys, thank you very much for answering the questions. You helped to allay some of my fears. Okay, so thank you.
Thank you.
All right.
Okay, so go get your vaccine. All right, Senator, thank you. Thank you again for answering these questions. I'd like to proceed now. You talked earlier in response to some of my questions regarding hiring, detail to the isolation and quarantine facilities. And if I could just go to those. So we've received complaints regarding staffing and at the quarantine facilities. We've received complaints over the weekend regarding the isolation facilities themselves. And I just saw a press release that the governor has now will be moving the isolation facility to another one. And so I guess I would just like, first of all, in general, some of these complaints involve personnel. I don't want to talk about that right now, but I would like to talk about your process, Director, about how do you handle complaints, first of all, made by patients. So can you please tell us if these patient complaints in the quarantine or isolation facilities, how they are dealt with, and because we've heard stories that they are not being dealt with properly.
Madam Director, our Director, Mr. San Agustin, he just stepped out of the office. I have Deputy Director Terlaje. The questions about how the Department of Public Health address complaints like we've been getting from the public about personnel. Is that the question, Madam Speaker?
Our personnel or?
Yes, please.
Yes, our personnel.
Our personnel or the National Guard personnel?
Complaints about public health employees. How do we handle that? With that, Speaker, we do have our Director back into the office.
All right.
Our Madam Speaker is asking how the public health handles complaints against public health employees.
With regards to complaints, ma'am, just as we have in any situation, we basically would receive the complaint. In most instances, we act on ones that are signed, but in some situations, depending on what's contained within that complaint, we really would have to review it and then make a determination what in that complaint we can actually look into and do an investigative review. It would also include meeting with the employee that are implicated perhaps, or the alleged allegations. If the person filing a complaint has any evidence that could support the allegations, we definitely most welcome that. And then from there, we look to DOA, because with the Department of Administration, they would be our resource with regards to guiding us in terms of progressive discipline. A lot of it also depends, well, not a lot, but a part of it also would depend on the degree of the infraction, the degree of the allegation. If it's such that it requires immediate action, then of course DOA will say, this is really what you need to do right now. And we will consult with them. and use them to guide us through the this progressive discipline process. And so it could be through an in-person visit to anyone in the department. It could be, or to my office or to me. It could be through email. It could be through correspondence that's received in the traditional sense of mail. So we'll receive it in any media or medium. And then from there, we will then act on that based on what is presented, Madam Speaker.
All right. Will you receive them anonymously as well?
Yes, we have received some anonymously, some even through social media. Staff will see something and they'll send it to me, or if individuals say, hey, this is something I want to see. And then we try to source it. And sometimes it's difficult with social media because we don't know if it's legitimate or if anyone can validate that information or the video. And so that makes it a little more challenging, but we will look at the situation nonetheless, ma'am.
All right. How many complaints have you received of this nature regarding personnel assigned to these facilities?
More recently, I have received one. I don't know. It was there was one that I received, and then it was like there was a follow-up to that, and then one that was received, but I don't know if it's from the same person. I think the person is perhaps monitoring what we're doing, only because I talked about the use of the room at our quarantine facility, and it appeared that they must have heard me speaking about that because in a more recent updated complaint filed with the department, they made a reference to me basically making a statement about the use of the quarantine facility in terms of the rooms being used in the process of swabbing of the facility, which we do. We do that at the quarantine facility, but for someone to associate me with that statement would have been someone who probably heard me either in a public discussion or perhaps on radio. I can't really say.
Are you saying that the only complaints you've ever received regarding personnel at these facilities have been recent? I'm aware of two. Are there more than that?
I don't recall any, Lori, or do you recall any prior to?
I have.
Yeah.
I have.
I'm looking around. Yeah, we have received.
What about complaints from patients as to the care they are receiving in those facilities, such as, a complaint that, they're experiencing chest pains and what is the procedure for them if they need help? You said, I guess, in your presentation earlier in one of the slides that they're supposed to call either the nurse or the Guam National Guard assigned to those facilities.
Right.
Is that right?
That is correct, Madam Speaker. Chima at one time was overseeing our quarantine site, but also we have Patrick. I'm looking for there's Patrick. And so, Patrick, you could elaborate, or both of you could share with the speaker and the committee about complaints at the QFAC, and then Xenia can speak about complaints.
Who handles medical complaints? I mean, complaints about medical, conditions. Is it the doctor on call, or is it the National Guard, or who is it?
How does it start and who addresses it?
Yes, so, Madam Speaker, it depends on what the complaint is all about. We have the HSP nurses that are there from 8 a.m. in the morning to 8 p.m. at night. And then we have the on-call nurses that are on call from 8 p.m. to 8 a.m. So when a complaint comes in the quarantine facility, if there is any complaint from the room, they first of all call the National Guard. So the National Guard will route the call to whoever is available to take care of the problem. If it's a room issue, they send it to the hotel. If it's a medical issue, they route the call to the on-call nurses who now respond to the room to speak with the individual. If it's something they can attend to at that time, they would. If they cannot, they will now call 911 to take the individual to the ER.
Okay, so they call 911. There's not a doctor on call in the facility.
There's a doctor on.
There's a doctor on call, but not in the facility.
For both day and night.
Yeah,
All
we
right.
have an
So
on-call doctor.
they'll call 911 to get them to the hospital. Okay. All right. Okay, Director, I'm expecting from you a report regarding some of the recent complaints regarding personnel, and that is still pending. I have not received it.
That is
that's
correct,
to
ma'am.
be- Okay, and so there have also been, over the months that we have been doing quarantine, there have been and isolation reports of exceptions, of course. So you've sent me your policies that outline the exceptions right now for quarantine. And I guess I would just want to ask, first of all, with the new strain that we are looking at, that we are at risk of receiving here on Guam, do you still agree that we should have exceptions to quarantine?
Well, Madam Speaker, right now, we're starting a conversation about that with the new strain. What could possibly do to add on another layer of perhaps precautionary step measures that would assist us in containing the potential of a new strain being introduced to Guam. So it hasn't been finalized, and but there are a step or two that we're considering at this point that we would add on to those that are given an exemption as a critical service worker, I think is what we are speaking of, Madam Speaker. And so then we would have added steps that would require those under that status who are granted that status that they would have to be required to be added onto their status. Not specifying the steps because they're in discussion right now, and I don't want to mislead that, people listen and say, oh, do we have to do that tomorrow? And we haven't made that yet an official policy, but it is regarding our.
All right, so you're considering for one group of people who currently receive an exception to quarantine, that is the, what did you call them?
For example, ma'am, critical service worker.
Critical service workers, that they may be subject to an additional qualification in order to do home quarantine. Okay, so,
yes, ma'am.
So
they're
currently, for the exception for critical service workers, they currently are allowed to test 72 hours prior to coming to Guam, or within 72 hours, have a negative test, come to Guam, and go directly to home quarantine, but they are allowed to go to work and then supposed to go back to home quarantine after work. Do you find that that is, that you're able to monitor that appropriately, that they are actually going back to home quarantine, and that them going to work is not putting additional risk on the community?
With regards to those in the critical service who present a negative PCR upon arrival 5 days prior to their arrival into Guam, Madam Speaker, you are correct in that they are given that restriction of movement we refer to as a ROM. Chima here has been looking at their degree of compliance. I don't know if you recall, Chima, if you could share with the speaker, what was your review of the compliance with regards to those in the critical service worker?
Madam Speaker, we've not had anyone who we actually seen a break quarantine, because the system is that the employer also supports public health in monitoring the individual who is on ROM status. So they go to work in the morning and they do a symptom check for the individual, and then after work, the individual is allowed to go home. So we've not had any instance where we got a report of someone who is breaking ROM for them.
All right.
If I may just add also, Madam Speaker, this is Patrick Lucis.
Okay.
Yeah. So we also have a travel home quarantine team that actually monitors those that travel to home quarantine. So we actually also monitor those that are on CSW status and also those that are on hardship status. They are registered with our travel home quarantine team, and so they are monitored daily as well.
Okay, great. I was just going to talk about the hardship status. So the hardship status, from what I'm reading in your standard operating procedures, you grant emergency hardship status, home quarantine exceptions for those who are on home hospice, attendance for funerals, hospital visitation for critically ill individuals, and caretakers for individuals with recently altered health status. And there, you also have an exception for medical and behavioral needs, such as those who require surgery or just had surgery within the last 8 weeks, are 75 or older, are pregnant, are immunocompromised, have a chronic heart, lung, or kidney condition, including requiring dialysis, currently undergoing treatment for cancer, have complicated nutritional requirements, have a behavioral health condition incongruent to remaining in the quarantine facility, or who require a caretaker. So are those still valid, let's say, exceptions to the government quarantine requirement?
Yeah, yes, they are. Madam Speaker, yes, those are still valid, ma'am.
And Director, do you review these on a case-by-case basis, or are these pretty automatic?
No, I wouldn't say they're automatic, but I don't necessarily review each one on a case-by-case basis. If they are requested, emergency hardship is requested, it's actually requested, Madam Speaker, at the quarantine facility. So there is a team at the quarantine facility that reviews the request. It's made up of a social worker. It also could include a health practitioner, and also we have a clinician on site. As you noted, one of the requirements is if it's not conducive for a person, perhaps with a challenge in terms of mental health condition, that person, of course, may be, based on the clinician's assessment, deemed proper and suitable to be then sent home to quarantine, as opposed to staying inside the quarantine facility. Of course, our goal there is to still maintain and contain the situation in terms of any potential spread. At the same time, we're really doing our best to try to balance that with someone's condition. And so if a clinician does deem that, our clinician on site, but he's also very flexible, that, you know, he's not there 24/7, but if we do need him in the evening, he does assist us as well. So he's very responsive in that regard now.
All right, because there were many complaints over the course of the past few months regarding this policy not being followed, that people were not being allowed to home quarantine who were under one of these conditions. And, you know, so do you believe that the media is getting this wrong, or, you know, have we evolved this in this situation or in this regard to having less complaints from those people?
Yeah, with regard to the complaints, I don't know, Patrick, or you have any recent complaints, Patrick, of any decisions that were not favorable? And any thoughts
Yes.
on that?
Director and Madam Speaker, when we do get these kind of complaints, we actually run the names through our system and ensure that these guys are actually approved for home quarantine, and they're actually being monitored. So of all the names and cases that we've seen, pretty much everyone has been eligible for their home quarantine and are also being monitored. So I have not come across any that that was in any violation. We do have our compliance team that, in the event that that we need to check if they're actually home, we do have a compliance team that actually goes out every week to check on these individuals or these homes.
All right. All right, thank you. I know my colleagues also have questions, so I'm gonna move on to them. I'll start with Senator Blas. You can begin this time if you're ready.
Madam Speaker, I don't have any. Well, I do. This is with regards to, I guess, payments. How are we with regard to paying our employees and those that are assisting? Are we running into any issue? Are we back in as far as overtime and differential pay?
Senator Blas, with regards to overtime and differential pay, recently, as early as today, actually earlier today, I was in communications with the director of BVMR, and we've identified a funding source. So we will be working with DOA. I believe they've already started that process, Tommy? They've already started processing the overdue overtime and hazardous pay due to the staff. And so we'll be moving forward on that front. What I've also been shared with is that for the second quarter, which we are currently in, that we're using federal dollars, is in communications that we will be using some of our program federal dollars to pay the overtime. So this is going to be settled in the coming days, is what I've been advised through BVMR, and Tommy, who's my administrative services officer for the department, has confirmed that DOA is starting that process.
How far back are you?
How far back are we?
Well, there's, for some individuals, we see that there's no method of, I've inquired with DOA payroll chief to see how does he process the overtime and the hazard pay? And he could not provide me an answer. I'm sorry. But we have individuals that have been paid and have like 3 pay periods remaining, while others have like 5 pay periods that are unpaid. Yeah.
Do you know if we go back to October, maybe? October, November?
As far back as October, yeah.
Yeah. We're estimating, Senator Blas, perhaps some overtime is due since October this current fiscal year, but October 2020.
But there are some that are even prior to that.
You have more than that?
Yes, prior to October, but, you know, unless I go through the whole list, or we go through the whole list, you know, there's no, I'm not able to provide you that information now.
Apologies, Senator, we don't have an exact date as to how far back it goes. We thought October, but the ASL is saying perhaps even further back.
My God.
Okay. Can you provide to the Honorable Speaker's office where you at as of today, and you know, what funding source are you using, and what problems are you going through? I mean, you know, now that we're getting down to the nitty gritty, when you're talking about you know people that have been basically working, and I applaud you guys. You guys are working 7 days a week, sometimes up to 10 hours a day. Something like this can really put a strain, on your frontline employees. And maybe going back to some of the concerns, some of the questions or complaints that people are having, that this may be the impetus to some of these things. So, Madam Chair, Madam Speaker, if you don't mind, if I can request for that kind of information to be forwarded to your office, so it can be shared with us.
Yes, I'm so glad. Thank you for bringing that up, Senator Blas. Excellent question and follow-up. Director, yes, this is something we've discussed earlier. Please, that information, we would like to see the details, because we've been told for months actually that the overtime is being processed, and then we get messages from employees saying that they have not been paid. And it's very disturbing that our frontline workers are being treated like that. And when I can't understand why it can't be solved in one day between you and the Department of Administration as to how we're going to pay them and getting them processed to be paid. Senator Blas, did I cut you off? I didn't mean.
No. I appreciate it. I think that's the pressing issue that I had with regard to this line of question. Thank you very much, Madam.
Yeah, Madam Speaker, the Administrative Services Officer, Mr. Taidegue, will prepare that report and we'll have it transmitted to your office.
Thank you.
Thank you, Madam Speaker.
Thank you very much. Senator Ada? Senator Ada, I can't hear you.
Thank you, Madam Speaker. With Senator Blas's question on funding, what federal funds do we have available for this situation? Are we completely exhausted on the CARES Act?
In terms of CARES Act for the vaccine administration, I have Annette, Dr. K, who can provide some response to that. If you could share some information in terms of our vaccine administration plan and our funding source.
Yes, Director. The immunization program did receive supplemental funding, and initially that over time that was approved was specific to immunization staff funded and their core regular grants, sir. And that includes nurses that are cost allocated as well, and then the immunization program staff, as well as like myself and admin support who are funded through the core grant. We just recently were awarded another supplemental funding of $1.42 million, sir, and we will be requesting for federal approval to use money to support overtime and hazardous pay. We were already given the clarification from our project officer that we can use this supplemental funding to also pay all these individuals who have been helping us at the pods, be it at Ukuru High School, other public health staff that have been supporting us and who are funded through other sources. We have now been given the okay to use some of that supplemental funding to help pay due to the support they provide us, to set up during and to break down the various vaccination pods that we've held, sir.
Okay, so, I'm just reading that was for immediate release dated January 6, 2021. HSS announces $22 billion in funding to support expanded testing and vaccination distribution. And when I go onto the site here, it says for COVID-19 testing, Guam has $9.6 million allocated. So is this funding available for at this point in time?
Yes.
And are we using this funding to pay personnel?
We will, sir. That funding is being awarded to the Epidemiology and Laboratory Capacity Program under the Division of Public Health. We actually just had a meeting, brainstorming meeting with the different key partners for the COVID response, from containment and isolation to the nursing resource, as well as for the immunization program. Environmental health was there as well. I apologize if I missed anyone. Dr. Cabrera was there as well to ensure that we are using this funds to where it's needed, to include like travelers' health, sir. There are plans to hire bodies for the airport screening, to expand our testing capability and capacity, be it for personnel or for equipment, the test kits, for environmental health, because they are doing the citations and compliance to immunization to help us, be it with equipment or supplies, as we know we have to do COVID vaccination clinics for months, down the road. Containment and isolation, be it for personnel as well, or to help with supplies and PPEs. So there were numerous suggestions brought up, and it's just now a matter of the different teams putting their justification, getting their price quotes, so that we can earmark it for this $9.6 million, sir.
Yeah, and you just mentioned about vaccinations, and I think we were awarded also $1.5 million for the vaccinations. So we got almost $11 million here. Madam Speaker, probably what I can do is request for a complete breakdown of where this 11.9 million or 11.6 million, whatever it may be, where they plan to allocate it and how it's going to be utilized. So in that way, we can get a better understanding. We have the budget process that's coming up, and we want to make sure that, whatever federal funds can cover, that it's not covered under local funding, Madam Speaker.
Absolutely. Thank you for that request, Senator Ada. Appreciate it. It's very important that we get the breakdown of how you plan to use this. I don't know if you're all aware that public health's budget, according to the governor's submission, has been cut by at least 12 million, between 12 and 13 million dollars. So very important to know how these federal funds are being used, because I think that's part of the rationale as to them cutting public health's budget. But it's very perplexing to me, so I would appreciate that report. Thank you, Senator Ada.
Yeah, definitely, Madam Speaker. And when you look at the cut and versus what we're getting in this federal funds, perhaps like I said, we want to make sure that we're able to utilize as much federal funding as possible, and then local funding can pick up where we can. Thank you, Madam Speaker.
Thank
Senator,
you.
if I
Dr.
may add-
Cabrera, you have your hand up.
Yeah, sorry, if I just may add, just to add to the federal funding is to ensure that everybody's aware of FEMA's 100% cost share increase. And so, as directed from the president back on February 2nd, that they will increase their cost sharing on all items that had already been previously approved, but retroactively going back to January of 2020, and will continue to September 30th, 2021. And so this specifically is about increasing medical capacity, non-congregating shelter, which quarantine counts as, and emergency feeding distribution. So that's what the three parts that are included. So that's not even included in this one part. So it's an additional benefit and a lesser. So instead of having that 20% cost share that we previously had in local matching funds, that now it's not.
Tommy, on our FEMA application.
Thank you, Dr. Cabrera. That's a very, very important information. Thank you for that. Senator Taitukui, you're recognized.
Just Madam Chair and Madam Speaker. You were talking about quarantine earlier, and I wanted to ask Dr. Cabrera, or even actually even the director. CDC has mentioned that they're looking at quarantine. They've lessened it from 14 days down to 10 days. And that's based on CDC's regulations or their perspective on this. So why is it that public health still has 14 days, 7 days in quarantine and then 7 days at home? That's 14 days, while other states and territories are now going at 10 days. I mean, I know the strain is there, but sure. The new strain, but it might play a role in this, but.
So I can answer that. And so basically, what the CDC recommends to us, and again, their recommendations, is the floor, it's not the ceiling. And so we, as our local jurisdiction, we have to consider what is in the best interest for our situation here. And so this is not even counting the strain overall. This is counting the uniqueness of what's in Guam. And it's not just about, COVID coming in here, but it's the resources we have again, and how fragile our healthcare system is, and how much more fragile it became during November, December, January, when cases skyrocketed stateside. Because then now, speaking of FEMA, they all of a sudden said, if you guys call for help again, we don't have any help to give you, basically. If you try calling for nurses and doctors, there are none. They're all basically allocated to all these other areas that are in dire need. And so it's because of all these other extenuating circumstances why we have to be more strict. However, I will say that we are looking at least the reduction to the 10 days, because that there is some reason that's behind that shouldn't affect us overall. But the key part here is that the most critical part is the quarantine in a government facility during that initial days. For vast majority of those persons who are considered not essential and are not emergent. So it's because of that why we have to. But we are constantly looking at it. But again, it's the floor, not the ceiling.
Well, Dr. Cabrera, I mean, if CDC and all the information and data and all the scientists that have, doctors who've gotten together to study this is saying 10 days, then I just don't understand what the holdup is, on such a long, 14 days down to 10. I mean, they even said 7 to 10. So I don't get it. I know you guys are talking about it, so. Please consider.
Yeah, absolutely, we'll consider it. I will also add that all of it is on almost a trust basis. They recommend that you get retested 3 to 5 days after arriving. They recommend you do all these different things. They recommend that but there is no enforcement in that. The CDC doesn't enforce that. The only thing they're enforcing right now is that 72-hour pre-arrival testing prior for international travelers. That's the only thing that they're enforcing, but everything else has no teeth behind it. So even within the States, so if we were to lower ourselves to that level, I mean, that could be absolute disastrous in us. But the 10 days does warrant more discussion and more serious consideration. I will agree to that.
Thank you for that. I hope the director heard that too, because I know that yes, he can make that happen. But anyways, Annette, you mentioned other agencies helping out during the vaccine, and you know, can you tell me if I think you might have answered, but does public health pay for, let's say, someone coming from Department of Labor or GVB, or you know, coming to help out with the vaccine? Do you pay it out of public health to give to the agency, or do the agency still pays it out of their budget?
I do know, ma'am, for the Department of Labor participants, for the dislocated workers, for any overtime or hazardous, the agency that they are assigned to, then where they did that overtime or hazardous, that agency is responsible for. So for public health, yes, we are paying for those Department of Labor assigned to us who are helping us for the overtime and their hazardous pay, while their regular pay is through the Department of Labor grant, ma'am. As in for the other agencies, I would have to defer to my director. I'm sorry, ma'am. Or to our ASO, I apologize.
Wait, that was what I was hoping for, Madam Speaker. Get a document actually showing those who've participated in the vaccine from the other agencies, and see what money is being funneled out of public health to go into these other agencies to pay for it. So if we can get that information to Madam Chair or Madam Speaker, I greatly appreciate it. It kind of sees us where DP Department of Public Health is spending their money. And Annette, I think you need a battery for that fire alarm, that beeping in the back.
Sorry, yes, our security.
I was gonna say, you're too busy to change the battery for your fire alarm. You're so busy, Annette. Thank you so much for all your hard work. I greatly appreciate everybody's hard work in this. And I just wanted to mention, you know, I've heard some stories at the very beginning, especially when public health started up at Santa Fe. I mean, that was a nightmare. All of us senators were getting calls from people staying there. And I'm glad that you heard the call of the public saying, no, take us out of there. It was bad. But, you know, I want to tell you, my sister came in, and then I have a friend who just recently was released from quarantine at the hotel, and they were treated very well. I asked them personally, how was your stay? How was everything? And they said they were treated very well. And I greatly appreciate that. However, I did call Chuma on this one too. The information that you provide them when they leave quarantine needs some help. I know that you give them a briefing before they leave, what they can and cannot do, but it's best in writing to put it on that sheet of paper where you provide those 5 different numbers for them to call and provide more insight. I think I was talking to Chuma about this. Hopefully, you know, you can incorporate into that document that's given to those who are leaving quarantine to self-quarantine at the house for 7 days. Other than that, I think that's it. Thank you. Thank you, Madam Speaker.
Thank you, Senator. Senator Moylan.
Yeah, thank you, Madam Speaker. So going back to that pay question, so Department of Corrections came out a few weeks ago to say that they are out of hazardous differential pay, and that was confirmed with Department of Administration. And they're just keeping their employees on and just tracking the numbers, and hopefully they receive more funding eventually. But for now, the pay's gone. So for Department of Public Health and for you folks there, the money isn't extinguished for your department, and it's just a matter of filing it and getting it paid out, or has it been zeroed out? Has DOA told you there's no more money for the hazardous differential pay?
Actually, Senator Moylan, they have it. Actually, the director, Lester Carlson, called today, and he and I were discussing this need to pay our staff the overtime here at Public Health and Social Services. And in speaking with him, he did indicate that we will have that paid out. And also, as Annette has shared, with regards to the additional funding that we received, the 9.6, they just had their meeting last week. That was the 1.42. Those combined funds will be also under my review, and I understand we'll be providing you a copy of those documents as well. but I will be reviewing those documents to ensure that we also account for the staff at the vaccine sites, those that are in the immunization program and those that extend beyond the program, to ensure that they are accounted for any potential overtime and hazardous pay. So we're looking to lean heavy into our federal funding sources with the supplemental funds that we received for both the 9.6, the ELC grant, as well as our vaccine administration, which will be about 1.42, sir.
Thank you, Director. Thank you, Madam Chair. No further questions.
Thank you, Senator Moylan. Director St. Augustine, can you just please clarify, are you saying that hazardous or differential pay, COVID differential pay is going to be made available after the executive order halting differential pay? Or you're saying this is for back prior to that executive order?
The ones that we owe, ma'am, that we owe for, well, we thought October, it might be actually prior to October, ma'am, so that we will do that, yes.
All right. Okay, I have two minor questions. If you could just clarify. First of all, critical service workers who are granted exemption from quarantine. Can you define critical service workers?
Key to the structure of our community, ma'am, it could be utilities, water, power categories will qualify. It could be someone who comes out here for a very specific purpose, to calibrate a machine, for example, a mechanism at one of our local hospitals, and they're only here for their periodic maintenance service. And they're only here for 3 days. And so if we put them in quarantine and don't allow them a restriction of movement, they're not able to service the equipment that is used in our hospitals and our clinics. So we allow someone in that category to allow them to do that.
It also includes doctors and nurses.
Doctors and nurses are under healthcare, ma'am. So we have another category called healthcare. And so yes, our physicians, our nurses, those in the healthcare professional practice are also considered exempt. But they still have arrival, the process, they have to present, and we have paperwork that we process here in the department. Those are the ones that either the deputy director or I review and grant approval for them to be given that status.
All right, and then National Guard member?
Well, the National Guard, because they've been activated, Madam Speaker, and some of them actually help us in our operations. At one point, they were helping us with containment. More recently, they helped us with our closed pods where we had our vaccination clinics. And one time they were also with us at our quarantine facility. Actually, they're still there at the quarantine facility, ma'am.
Yeah. So do you have a list of those who are they considered critical service workers or healthcare workers?
No, with regards to the Guard, we use them as critical service worker, critical to our operations at QFAC.
Critical service workers.
Yes, ma'am. Critical service worker.
Yeah. Do you have a list of those who would be in that category? Or is
I don't have an existing list. It's really reviewed on a case-by-case basis. What is presented? What is their function? We look at what is their purpose, for the request. What is it that they do? So if someone says, I work for a company that may be deemed essential, but they're a messenger, just as an example, and no disrespect to any messengers who are watching this or family members of messengers working in a critical service company, we may not grant that person the exemption because the person actually, what is their function? If their function is to deliver documents, pick up documents, and someone else obviously was able to do that while they were away, then they may not be deemed suitable as a critical service worker as compared to someone who's here for 3 days to service and provide maintenance to equipment that's being used by our healthcare practitioners or our clinics. And so the review is really done that way, ma'am.
Okay. And then, but we've seen cases where though they've tested negative prior to arrival on Guam, and as they're supposed to, these critical service workers, and then they are assigned to home quarantine, but they're allowed to go to work, but then they eventually test positive. Is that correct? That's what's been reported in the media, and I just want to confirm that is possible.
I don't mean to look around, Madam Speaker, but I'm looking for my staff to give me any confirmation because, this is a huge operation. So we've got Chima, Patrick doing just, quarantine, oversight, containment. Zinnia's got ISO. Do we have anything that you know? The CSW? Yeah. Patrick, do you know anything, or Deputy Director?
The only time that would happen, Director and Madam Speaker, is that if we do have a previous positive who has actually been cleared from their COVID, they actually don't quarantine. They're allowed to go home as long as it's within the 90 days. Anything after 90 days that shows a positive, then we'll have to actually have them isolated.
Oh, so previous COVID patients are exempt from quarantine as well within 90 days.
Within the 90-day period. Yeah. But also, Madam Speaker,
but back to the critical service workers. Yes, it was reported in the media that a couple of the National Guard members who came back from DC tested negative before they arrived on Guam, but then tested positive after, while they were on home quarantine. And so I just, wanted to confirm that has that happened often with critical service workers, or are those the only two cases that you know about?
We don't have any record of that, ma'am.
But just recently was reported.
Pardon? I beg your pardon?
We'll look up our records.
Madam Speaker, with regard to the recent news report, we'll definitely have to check our other team who's not with us this evening with regards to that. But we don't seem to have a recall of it happening on a more frequent, regular basis. With regards to the exemption, it's really done at the organization level. So every now and then you'll have a sole proprietor, and that is one of the options of doing business. But more often than not, this comes from the organization describing the request for the exemption.
All right. Okay. And then I received a message that are the clinics being given their vaccines as planned, or has there been a change in how many vaccines each clinic is going to get? Do you stop giving vaccines if you think they are not, if something happens? I mean, it seems there's a concern that the clinics are not getting their vaccines.
Go ahead, Annette. I know Annette wants to respond to this. Go ahead, Annette.
We've had to reduce quantities that were requested as we were about to run out of vaccines. Again, as we onboard more providers, there is a wide range of how much each provider orders. Some are minimal, 20, 30 doses. Some are 50 to 100 doses. And then we have the larger clinics or pharmacies that are asking 300 to 400 doses. One of the requirements for being an enrolled provider is you have to report vaccine administration data because the jurisdiction is required to report it to CDC. So we have the ability to look into our registry and to monitor inventory and vaccine administration data. So again, if we're seeing a large inventory in a specific provider and they're asking for another 300, 400, we first will have to clarify, are you backlogged on data entry, or do you have all this inventory sitting in your clinic and we don't want to give you more while we're shorting another clinic, ma'am? So it's a balancing. And so we do monitor that on a case-by-case basis. And again, it also is, as we were pushing out so hard to, as Dr. Cabrera said, race to vaccinate, we were going through our vaccine supply so quickly that unfortunately we had to reduce some providers from their original request.
Dr. Cabrera?
Yeah, if I may just add to that. So just so everyone gets a sense of this. So 2 weeks ago, we vaccinated well over 5,000 people in 1 week, just under 6,000 or so. And then a week after that, we vaccinated just under 10,000 persons. And then last week we had to throttle down and we vaccinated again just under 6,000 persons. We used up 95% of our allocated stock up until when we got our Moderna shipment in on last week, Thursday. And so that's how much we were pushing the edge. And there isn't the only state that's used up most of their allocation is like North Dakota, who went up to 98%. So we were really pushing this, so we had to make some really tough decisions in this process here. So you know, they were tough, and you know, it didn't. A lot of people were not happy about that, but in the end, it was you know, we're now at a better position to allocate more vaccines, of course, to these our partners.
All right, thank you, and I'm glad you brought that up. Are you going to continue to reserve that second dose for people to get their second dose promptly, or I heard you saying, I think in the media, that you might push out the first doses without reserving that second dose?
So we've actually been practicing that already. The fact that we even were pushing out up to 95% shows that we were using up any reserve dosaging for second doses. I myself not have read too much about what was in the media in the second doses, even though I gave some of the interviews myself. But the reality is that we were trying to ensure that the public understood that it was perfectly medically appropriate to delay even just a little bit your second dose. And in fact, there's some data to believe that if you delayed a little bit and you give your body a little bit more chance to rest, that when you get that second dose, you're going to have a much better response for the long term. And so because of that, the CDC themselves have actually even said that you feel free basically to schedule second doses up to 42 days after your first dose. Doesn't matter which vaccine you had, up to 42 days. We tried our best to make it at that 21 days for Pfizer, 28 days for Moderna, because we just wanted to be sure that we had a narrow target, because we didn't know what the compliance was really going to be. Were people going to be just happy with getting the one dose and then not come back for their second? So we tried to do that, but we learned that we had up to 93% compliance for that second dose. And that was so we're like, wow, everybody's really, really hitting this. And we're really proud of our community for doing that. But we needed to relax that a little bit and relax the expectations and say, hey, it's not bad if you get it a week after your due dose. I myself personally waited 1 week after when I was due for my second dose. And I had circumstances when I had a busy clinical schedule, and I didn't want to jeopardize that if I got, you know, some symptoms from my second dose. And so I'm speaking from personal experience, and so that's where that part is. So yes, we are using second dose. We're not reserving these second doses completely, and in fact, the strategy in the United States as a whole is re-looking at second doses and actually looking at saying, hey, it's a race to vaccinate because of the race against the strain. So if we at least get first doses in everybody, then that improves our chances of not having these strains be as widespread as they currently are. I mean, spreading much faster as they currently are.
Madam Speaker, sorry.
Yes, Director. Yeah, is this a policy that has been adopted by your vaccination committee, priority committee?
It is not a policy. It's a discussion. It's purely at discussion level right now.
All right, Director, were you trying to
yes,
say something?
I just wanted to share with you, Madam Speaker, and the rest of the members here this evening, is that also Tom, Nadeau, and Annette have been working. And so what we're doing with our 17,000 total doses that we received in February is we're earmarking for the Guard, but we're also putting a earmarked number that they've worked through for the other for the other clinics that have become enrolled. We want to be able to get them an amount that they would work for the month. And so, for example, Company A would get 300, but we got to let them know that's your allocation for the month. Kind of similar to what's happening. We got 17,000. We have no control over that. You know, if we could ask for more, we definitely, as many have said earlier, it isn't that there isn't a willingness or the manpower to vaccinate more and offer more clinics. It's actually the amount of vaccines we're receiving. So Annette and Tom have worked with Major Louis Cruz over at UOG, how much he'll be receiving, so that he can run the vaccine site there at the University of Guam with the help, of course, of the volunteers and the guards, and how many are being allocated for the different vaccine clinics now, so that they would also have some vaccines, right? Because on a really good day, we can easily vaccinate over 1,000 people. And with 17,000, and we just did a single dose approach, in 17 days, we would be out of vaccines. And so we can go over 1,000 in a day. And so we would be at the end of February with no more vaccines, whether first or second. So we really had to plan it out the best we can and work with the Guard so that they still have their clinics and people can still get their vaccines. Thank you, ma'am.
Thank you. I appreciate that. Those discussion on that strategy. I am just a little concerned that if they are, enthusiastic about getting their vaccines, and I want to make sure that they can get their second dose and not be put off. But I think if they start being put off from their second dose, they might be discouraged, and I don't want to discourage anyone. I think we need to keep continuing them. But I know you're discussing all of these options, and so I look forward, if there is a different policy that is adopted by the prioritization committee, please send that to us, and I will make sure that all my colleagues are informed, please. I appreciate you all being available tonight for this discussion. I think the whys, answering the hows and the whys, are very important for the community and the senators to be brought along with your strategy. And that hopefully we can find ways to help you and to be consistent with your strategies and your successes. So we're wishing you continued success with this vaccination program, of course, and our quarantine program, our testing, our tracing. We don't have enough hours in the night to talk about it, but I do appreciate that you're very, very busy and you took time out to have this discussion. And, I hate to pull you away from your other duties, but I very much want transparency. I think it's very important to bring the community along with what you're doing and to open it up as well to suggestions from the senators. So appreciate your being here. Director, deputy directors, Doctors Cabrera, all the doctors, Dr. Kaneshiro, and of course, all of you who have worked very hard, Mr. Nadeau, Annette, Rosanna, all of you, Ms. Scroggs, thank you very, very much. And Senators, Situs Maasi, for your presence and your excellent questions tonight as well.
Madam Speaker, I just have one question. One
yes,
more question.
Sure.
Just for, thank you, Madam Speaker. What is the definition of homebound? What is your definition of homebound?
Dr. Kaneshiro, I know we both know this, but you're running the Homebound program. Why don't you go ahead and provide the definition? Well, our homebound, I'm sorry, Dr. Gay, go ahead.
So homebound is somebody it's a person who's bedbound, for example, who can't get out of bed, just can't leave the house. Somebody who's frail, and somebody who's unable to, I can't see it, unable to leave the house for too long a period. Also, they have, I think, Art, you're better with this one because you're a senior citizen.
Fine.
For the activity.
It's really it's our senior population who are having challenges like transferring in and out of bed. They need personal queuing to provide their daily activities. So, Dr. Key, you defined it. That's pretty much our definition, Senator Rada. It's someone who has challenges with their activities of daily living.
Yeah, I'm just asking because I know it was mentioned earlier that as long as you can get into a wheelchair, then, to go out and get vaccinated. And, there was concerns about that because, yes, the individual may get from the bed to the wheelchair, but was not able to leave the home. So, I just want to make sure that we have it clear out there for our folks who, have the ability to get out of bed, but, the difficulty of sitting in the wheelchair for periods of time, and that, it does bring a concern to them. So, just for clarification, I just want to make sure that the public knows that, yeah, if you need to be, if vaccinated at home, then, that we have that available to them.
Yeah.
Yes, Senator, thank you for bringing that up. I want to thank Public Health for being a little lenient on their original response to that they, were going to be, that they have agreed to cover all the homebound that were on the mayor's list, the different mayors. And so they are working on that. So they're doing one round across the villages. They are going to do senior centers in the villages, and they are going to go back and do another round, I think, if they have an additional homebound persons to take care of. But they did agree to take care of the list that the mayors had compiled. Yes.
Thank you, Madam Speaker.
Deputy Director Dueñas.
So, Madam Speaker and the senators, you may also want to know that we didn't just limit it to the ones that were homebound. What the staff did is they also included their caregivers, because it was very critical that, they're having to be there, and it's going to be difficult for them to go to one of the pods to get the vaccination. So they've included them as well.
Thank you for that as well, Deputy Director. I thought that was an excellent idea and an excellent use of your discretion to extend it to the caregivers. Thank you again. And again, these programs evolve. We watch as you, quickly remedy any issues that come up and quickly come up with other ideas. And I very much appreciate that. So I want to thank all of you again, and it's been long, but very worthwhile. I hope you all feel the same. So thanks again. There being no additional testimony or questions, we are going to end this oversight hearing. It is now 8:24 p.m. Si Dios más y todos. Gracias.
Thank you very much, Madam Speaker. Thank you.